Hi, I'm Steve Osofsky, professor of wildlife health and health policy at Cornell University's College of Veterinary Medicine and director of the Cornell Wildlife Health Center. I want to first thank all of our presenters and everyone watching for joining us today for what I believe will be a robust exploration of one of the most important challenges of our time: how we as humanity can better govern our own behavior to make pandemics significantly less likely going forward. The next pandemic could easily be even more deadly than COVID-19, and the esteemed experts we've assembled today will be sharing their ideas on how our global community of nations can hopefully come together to prevent what I fear could otherwise be a cycle of recurring suffering. As a wildlife veterinarian focused on how the health of wildlife, the health of domestic animals, and our own health are all inextricably linked together and intimately connected with the health of our environment, I want my fellow global citizens, all of you, to know that the coronavirus pandemic was preventable. It was not a surprise, it was predictable, and it was predicted. In terms of COVID-19, we did not have to get to this point. For decades now, many of my colleagues and I, working at the intersection of wildlife conservation and public health, have been warning that human behaviors, in terms of how we interact with the natural world, were greatly increasing the risk of a pandemic. I want people to know that the majority of emerging viruses come from wildlife, not to blame wildlife or to create a backlash against wild creatures. In fact, I would argue for the opposite. What we need could perhaps best be described as behavioral distancing, not to be confused with the social distancing we've all been encouraged to adopt, but just as important over the longer term. While there are literally hundreds of thousands of viruses in mammals alone, there are really only three basic ways we, through our own behaviors, invite them into humanity's living room. We eat the body parts of wild animals, we capture and mix wild species together in markets for sale, and we destroy what's left of wild nature at a dizzying pace. Just think about deforestation, all greatly enhancing our encounter rates with new pathogens along the way. Our species simply cannot continue to pillage what's left of wild nature and our planet's fellow species. While I've spent my career trying to think of ways to enhance my own species' respect and concern for the rest of life on Earth, perhaps a tiny invisible virus will be what actually, hopefully, tips the scales towards a critical mass of global understanding of the fact that our own health is intimately tied to how we treat the natural world. This is the essence of the One Health concept we first launched almost 2 decades ago. Forests, freshwater systems, oceans, grasslands, and the biodiversity within them support humanity with, among other things, clean air, clean water, a climate stabilizing mechanism, and healthy food if we behave ourselves. So whether we are talking about mitigating the global climate crisis or preventing the next pandemic, we need to redefine our relationships with wild nature and our fellow species at this critical juncture in the history of human civilization. Like the SARS coronavirus behind the outbreak of 2003, severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, almost surely originated in bats. Whether someone handled or ate an infected bat or another animal that had been infected by a bat, we will likely never know. Even if this pandemic started with a lab accident, which I personally doubt, the important point is that the upstream source of most viruses with pandemic potential is wildlife. One thing we know for certain is that markets that sell wildlife for human consumption often feature domestic and wild animal species, a mix of creatures from the land and sea from all over the world, all crowded together along with the pathogens they carry. Many, if not most, of the free-ranging wildlife-related supply chains feeding these markets are illegal, and many are leading to the extinction of a wide range of wildlife species in high culinary and/or cultural demand. For decades, the conservation community has tried extremely hard to stop this trade without success. The demand and profits to be made have been too high, and world leaders never seem to feel that the costs to global biodiversity mattered all that much. While we missed our chance to stop SARS and now SARS-CoV-2 from emerging, how many more times must humanity allow this cycle to repeat? It's time for markets selling wildlife, especially mammals and birds, in places where people have other sources of nutrition to be deemed totally unacceptable to humanity. Now, I want to make a very clear distinction here between those who need to eat wildlife and those who prefer to. The lowest hanging fruit in terms of preventing pandemics is mitigating threats emanating from wildlife markets and wildlife consumption in places where people don't actually need those products for their sustenance and survival. There are, of course, many parts of the world where people need to eat wildlife to survive. And that is a longer-term issue related to poverty, food systems, and food security. Those issues, of course, must be addressed, but we can and should immediately focus on wealthier areas where wildlife is still consumed, but not essential. This is where risks can at least start to be mitigated. So it's clearly time for us to adopt some behavioral distancing when it comes to wild nature. While earnest conservation arguments and related attempts at moral suasion have failed for decades, the pandemic crisis does offer a huge opportunity for the global community to finally come together on an urgent issue that can only be addressed by a unified response. We have the Montreal Protocol on substances that deplete the ozone layer. We have the Paris Agreement on climate change. I mention these examples of global treaties not because they are perfect or because I am sure a treaty is the solution to mitigating pandemic risks, but in terms of global governance, a key theme of this webinar, it is clear that to date, we have failed to mitigate pandemic risks. We have thus far clearly failed to control our own behaviors in ways that would make the jumping of pathogens from wildlife to people less likely in the future. I very much hope that today's deliberations offer practical ways forward for urgently addressing what is a critical gap in global governance. I again want to sincerely thank our assembled expert panelists and all of you watching for generously sharing your time and insights today. I'd now like to turn things over to WWF's Nick Sacron for his initial thoughts. Nick?
Thank you, Steve. I'm Nick Sacron and I'm the Chief Conservation Officer at the World Wildlife Fund. Last year, we at WWF undertook a detailed scientific analysis to better understand the drivers of zoonotic disease spillover risks and the levers that policy practitioners can employ in reducing future risks and future spillovers. Now, as you laid out, there are many drivers that we need to address, but tackling the trade and consumption of wildlife is paramount amongst them. More than 60% of the emerging infectious diseases in humans originate in animals, and more than 70% of those come from wild animals. So the question arises as to how best to address that. Now at WWF, we've been tracking the decline in wildlife numbers over many years, and we publish data in our Living Planet report. The latest report indicates that we've witnessed a staggering 68% average decline in wild populations of vertebrates. That's mammals, birds, reptiles, amphibians, and fish since 1970. So our wildlife is under significant pressure. A major source of that pressure is the trade, legal and illegal, in wildlife. And this is estimated to be worth over $20 billion a year annually. And this is a really big challenge, and even the best resource governments are finding it difficult to implement the array of wildlife trade obligations and laws that they already have on the books. Now, why are these animals captured? Well, they're captured for food, they're captured because they're delicacies, they're captured because they're luxury items, they're captured because they're medicinal products, and they're also captured for the pet trade. Some of this trade is legal, some is illegal, and much is simply unregulated, unstudied, and unknown. Let's consider the plight of the pangolin. This scaly anteater, a group of species found in both Africa and Asia, is the world's most trafficked mammal. Their high value on the black market as a status item, both for their scales and for their meat, has created a vicious cycle of supply and demand. And the rarer and more expensive they become, the more desirable they are to luxury consumers. One very conservative estimate suggests that one pangolin is taken from the wild every 3 minutes. And now the pangolin has been implicated as a potential intermediary species for zoonotic disease spillovers. And so it is a major issue in the context of how we deal with the pangolin trade, but also the many other species implicated in risks in terms of the nature health equation. Now, as you said, Steve, the trade we're concerned with is not local subsistence hunting. Indeed, local communities around the world depend on hunting to meet their needs. But we're concerned rather with the large-scale commercial trade of species that can cause these public health risks, species like pangolins. Now, unless we reduce large-scale consumer demand for wildlife that can generate another pandemic and cut off the supply, the risks will recur. Now, I happened in my previous job when I was at the UN to be involved in the design and rollout of the recovery efforts following the Ebola zoonotic disease breakouts in 2015. And as we were designing the recovery efforts, I asked whether or not we should include in recovery measures to address the root causes. Clearly, we knew then that this disease emanated from the consumption of wild animals. And of course, the bushmeat trade in West Africa is enormous. And my question was, well, aren't we just setting ourselves up for another outbreak in the future unless we start to invest now in changing behavior? And our panel, our experts and those who were engaged in designing the recovery looked at this issue and said, well, look, it's too complex. We have other priorities. It's unlikely to happen again, and therefore not worthy of inclusion in the response. And so it wasn't included. I hate to say it, but there is another outbreak of Ebola in the Guinea Forest region as we speak. During the outbreak in 2015, the markets bush trade for bushmeat in major cities like Monrovia, they dried up. People stopped eating wild animals, but they're alive and thriving again, and they were alive and thriving soon after the outbreak was brought under control. So the question is, going forward, what will it take to change behavior? Will we this time round accept that there is a major risk inherent in the consumption of wildlife and the illegal trade? Will we this time around incorporate into our recovery efforts measures that reduce those risks, recognizing that we need to invest in the protection of nature in order to ensure human health? Or will we, as in the case of Ebola, suggest that the problem is too complicated and leave it to another generation to fix? Because, ladies and gentlemen, the risk of another spillover is significant. So that's why we're here today, to listen, understand, and discuss how best we might address this complex issue. Our speakers won't necessarily agree with each other on the best way forward, but we believe each speaker with us today has expertise and valuable insight to help guide the way forward. And we're looking forward to a lively, dynamic discussion. And with that, I'll turn over to our moderator. Doesn't need to be introduced really, Tom Friedman, who spent his career examining and writing about foreign affairs, global trade, and environmental issues. We're delighted to have you here with us today, Tom. Over to you.
Nick, it's a treat and an honor to be here for this meeting. It's just so important as not only we sit here recovering from the global COVID pandemic, but in the United States, we've seen how intimately our lives and future and the stability of our economy depend on nature, from the crisis unfolding in Texas today. For more than a year, the world has grappled with a pandemic that has infected now more than 100 million and killed almost 2.5 million people around the world. The additional toll it has taken on commerce, travel, family life, education, and mental health, not to mention medical care more broadly, it's truly incalculable. And it's all but certain that it began with people somewhere capturing, trading, killing, and eating a bat. Today, I'm looking forward to moderating a discussion with some of the world's top experts in conservation and public health as we discuss how we as humanity can address a global wildlife trade and consumption so we may never have to face a pandemic like this again. Each speaker will share their views during our 2 sessions, followed by question and answer panels where we'll take your questions. And following the panels, you'll be treated to a keynote address by one of the world's most important wildlife champions, Dr. Jane Goodall. As Nick said, I referred, there'll be time for questions during each of our panel discussions. If you have a question you'd like to ask, please use the Google form at the bottom of your screen. Our team behind the scenes will be monitoring your submissions throughout the day's event, and we'll address as many as we can in my conversation with the panelists. I know, as Nick again said, that our speakers don't all necessarily support the same approaches. That's good. I'm looking forward to exploring and learning more about where there might be consensus on addressing the global governance challenge that truly upstream pandemic prevention requires. So let's begin. I want to introduce our first panelist, Dr. David Nabarro. He's a special envoy on COVID-19 for the World Health Organization, as well as co-director of the Imperial College Institute of Global Health Innovation in London. Without further ado, Dr. Nabarro.
Well, hello, and thank you very much indeed for that lovely introduction and also for the chance to be with you here today. Just why am I here? Well, first of all, as Tom just told you, I have got this role working as special envoy for the Director General of the World Health Organization on COVID-19. Actually, I've been working in public health for about 45 years. But it was in 2005 that I first got really involved in disease outbreaks. I was working for the World Health Organization. Actually, I was responsible for the health emergencies program there. And I was asked to go and join the Secretary General of the United Nations when there was a meeting of the leaders of the ASEAN nations, that's the nations of Southeast Asia, during 2005, with big worries about a particular kind of influenza that affects birds that was spreading rapidly throughout East Asia and from time to time was causing sporadic illness in humans. And the worry from the leaders of ASEAN nations was as follows. Is this virus going to jump from birds to humans? Will it cause a major and severe flu pandemic, and what can we do to prevent it? Now, what was impressive to me at the time was firstly that the Secretary General of the United Nations said, I think we might have a problem here. And Kofi Annan asked me to work with him to respond to the worries of the countries of East Asia. And secondly, the leaders of East Asia were really concerned that bird flu, as it was called, was going to become the next human influenza pandemic. And they said, we've got to work together to deal with it. I want you to really hold on to that for the next few minutes, because what was important to me was that the #1 person in the United Nations was convinced by presidents and prime ministers from East Asia that we had a major problem potentially going to affect the world, and that the leaders of the nations of East Asia said, we want to do something about it, working together. And it was further than that, because what happened was that particularly in Thailand, but also in other countries in the Mekong sub-region, so that included Vietnam, Laos, and also Cambodia and Vietnam, as well as southern China, all came together, particularly with their technical staff, and said, we've got to do something to prevent a pandemic coming. We've already, they said, experienced SARS in East Asia during 2003, and they were worried that what was going to happen with influenza, the bird flu, would cause an even worse problem. And so as the heads of the countries came together, I noticed them setting about doing one vital thing. They said, let's bring together our specialists working on animal health and human health. Let's try to make sure that we can keep an eye open in villages throughout the Mekong Delta to find flocks of birds, either domestic and reared birds or wild birds that were dying of bird flu, in order to be ready for the possibility that the virus might jump from birds to humans because of a real worry that it might not just be 1 or 2 cases, but it might be a big pandemic. I was really impressed. I want to tell you 3 reasons why I was impressed. Firstly, it was national prime ministers and presidents that said, we have to bring 2 big health disciplines together. And it was their staff, the district veterinary officers, the district public health officers, sometimes teaming up with the district environmental health officers in different countries, who said, we're going to find ways to work together. And it was their community level workers who actually traveled to different places at the local level together to work with those who were looking after birds, to visit hospitals and create a sense that working together was the right thing to do. So there were occasional, what we call sporadic overspill events, when perhaps a household or a few households or a hamlet of households in a village would get ill, and occasionally, unfortunately, people would die. But because of incredibly careful action to identify sick birds as well as sick people very quickly with what was called in Thailand the X-ray eyes program, I believe that pandemics were avoided. Now, I can't be sure. And that's the whole point. With this kind of work, you have to spend masses and masses of time preventing. Each year, our World Health Organization receives thousands of alerts of viruses appearing to perhaps to jump from animals or birds to humans. And then our World Health Organization has to work quickly to make sure that it doesn't become an established infection in the human population, that it's isolated and dealt with. Now that is One Health in practice. Why isn't it more widespread? Well, possibly because we don't have many leaders like Kofi Annan, that UN Secretary General who saw the need to actually set up a One Health program inside the UN during his tenure. Perhaps it's because there are not too many presidents and prime ministers like those of Southeast Asia, who in 2005 had really been affected by the power of SARS in 2003 to cause billions of dollars worth of suffering and damage. Perhaps it's because in East Asia, it was possible for the veterinary specialists, the human health specialists, and the environmental health specialists to work together because they felt that it was important to work on a common issue. Either way, that was showing what needs to be done, but it has not been repeated enough. So here are my 4 prescriptions. Number 1, keep the United Nations family deeply involved. There are arrangements to bring different parts of the UN together, not to work in a siloed way. Keep them there. Number 2, work with the universities that have set up programs for One Health education to make sure that veterinary health and human health work closely together. Number 3, get governments involved, running joint programs where they possibly can, especially in areas where there is a risk of shift. Number 4, look to ways to prevent these events happening. Obviously, try to restrict the capture and consumption of wild animals, but also be very careful what happens when wild animals are farmed, for example, in mink farms or raccoon dog farms or other farming of wild animals, because that can lead to the emergence of these pathogens. Thank you very much indeed for the chance to speak to you at the beginning of this event.
Nick, thank you very much for that interjection. I want to next introduce Doreen Robinson, who's Chief of Wildlife at the UN Environment Program based in Nairobi, Kenya. We're glad to have you joining us from there, Doreen.
Thank you so much for the opportunity. So here we are, fast approaching the 2nd year of the pandemic, and we have learned a lot of lessons that are relevant for global governance. So lesson 1, healthy people require a healthy planet. There's simply no way around the fact that our natural world is the foundation for our health and well-being. The food, air, water, medicines we need, and nature are all inextricably linked, inseparable from our very ability to exist on this planet. And we humans, we are not treading lightly. In fact, we're gobbling up plants, animals, and other natural resources faster than any time in human history. And as we devour, we degrade and alter ecosystems, destroying nature's life-sustaining services. So lesson 2, humanity has a serious consumption problem. As a co-author of UNEP's report, Preventing the Next Pandemic, we identified 7 major anthropogenic drivers of pandemic risk, including overconsumption of wildlife. But we identified another major consumption problem driving up zoonotic disease risk: the demand for domesticated meat produced in intensive agricultural systems. At least 25% of all emerging infectious diseases and about 50% of zoonotic were linked to intensive agricultural systems since 1940. Which leads me to the third thing we've learned. Pandemic risk is closely tied to a complex global food system. And if we're going to reduce our risk for the next pandemic, we need to transform that food system into one that isn't dependent on environmental destruction. A new system that works with nature and protects its diversity with healthy production systems and sustainable diets. Now, there's some evidence that wild meat consumption is rising in some places during the pandemic. Wildlife is an important safety net for the poor. A 2018 study showed that 154 million households, more or less 833 million people, rely on wild meat to some extent across Latin America, Africa, and Asia. But we have to ensure sustainability. But we also have to understand the consequences of removing wildlife or the income generated from wildlife from the global food system as part of our response, which leads to the fourth lesson, inequality. COVID has spotlighted that the risk of pandemics and the ability to prevent and respond to them is linked to entrenched systemic inequality. Right now, 130 million people are at risk of backsliding into extreme poverty. We know that sustainable, legal, and well-regulated use of wildlife resources supports millions of people around the world. The UN Comtrade Statistics Database showed in 2018, the total global value of all biodiversity-based exports was $864 billion US. Behind that number is a story of jobs, food, school fees, and an incentive to keep land and sea in conservation status. If that income is lost without viable alternatives, the incentives for conservation can change. But to be clear, not all that trade is sustainable, and not all the benefits are flowing to conservation or to those who bear the costs for living and protecting wildlife. And of course, illegal trade undermines everything. We can do better. So what do these lessons mean for global governance? First, we need stronger governance frameworks grounded in science and risk-appropriate policy responses. And that framework has to deal with our inequitable consumption problem. Increased understanding of complex risk profiles for species, ecosystems, and value chains is needed. We also need better assessment of costs, benefits, acceptability, and scalability of alternative responses, using economic, social, and environmental sciences together. And we also need to ensure inclusivity. Inclusivity in generating the evidence, but also in assessing the alternative options. Traditional knowledge and creating an equitable space for the voices of marginalized populations is foundational for better governance. Demand management, which we've heard about, is also an essential part of appropriate governance systems. The second thing we can do to improve governance, we have to work better and smarter within the environment community. Environmental governance itself can be extremely fragmented with a narrow focus on a specific problem, a specific institution, or even a specific tool. We already have a large range of multilateral and regional environment agreements in place, but are we maximizing their coordination and effectiveness? And more so, are we getting outside of the environmental bubble and doing it effectively to leverage other governance frameworks? For example, we can work better with trade agreements to integrate material and reputational risks associated with health, and to improve monitoring along regulated value chains. We can do more with the private and financial sector to inform industry practices. Stronger environmental health safeguards can protect high-risk species, ecosystems, and vulnerable livelihoods. Best practices in harvesting, processing, and movement of wildlife products is also needed and requires frameworks within transport, infrastructure, trade, and customs. But all systems, all practices need to be backed up with strong systems and standards for accountability, including rooting out corruption. We have to embrace the fact that no simple solution is available to a complex problem. One Health approaches that look across the nexus of human, animal, and environmental health need strengthening. The environment dimension of these approaches has received less attention, and that has to change. At the global level, UNEP is working to join the Tripartite Alliance for One Health between WHO, FAO, and OIE. UNEP's membership is precisely meant to strengthen that environmental voice and to bring in additional expertise for prevention, preparedness, and response. And we'll rely on our environmental partners and networks to support that work. While expanding science and evidence is essential, we have to break down entrenched institutional barriers that limit cooperation across ministries, sectors, and across society. Of course, global frameworks are only as good as they're able to be implemented at local and national scales. We know that skills and capacities really vary on these issues. When it comes to pandemics and prevention, the weakest link really matters, and it deserves attention. Lastly, we cannot afford to let short-term crisis mentality undermine the future of life on this planet. Wildlife, natural resources in general, are the invisible drivers of human well-being and economic life. Unfortunately, our current governance systems tend to value only what's visible. So we need to make wildlife, make nature visible. We need to put it on the ledger, and we need to count it in economic and political decision-making. And a lot more political will, a lot more Kofi Annans are needed to make this a reality. Whether it's the Conference of Parties for all 3 Rio conventions coming up later this year, or national fiscal stimulus and green recovery packages, we have an opportunity right now to upgrade and strengthen governance to address the root causes of pandemic risk, the destruction of nature. So with these opening thoughts, I look forward to a deeper discussion with my co-panelists and participants. Thank you.
Doreen, thank you very much for that. Our final speaker for this panel is Dr. Richard Koch. Richard is the co-chair of the IUCN Species Survival Commission's Wildlife Health Specialist Group, and he's also a professor of wildlife health and emerging diseases at the Royal Veterinary College in London. Dr. Koch.
Thank you very much indeed for this opportunity to talk. And the colleagues who've spoken before have been both erudite and, I highly respect what they say. But I'm not going to make any excuses. I may not say things that people necessarily want to hear. But I have 2 things. I'm extremely passionate about wildlife, and I'm also very passionate about the truth. So I'm going to show you these slides, which I hope will just present a few key messages that I think are relevant in this context. And really, the title is, could a global wildlife health authority have prevented the COVID-19 pandemic? So that's really the theme. In other words, are we set up, are we structured to be able to do this sort of, to deal with this sort of problem? So I'm just going to show you the slide, which is really actually looking at health, how we look after health, human health. And these are complicated slides, but you can see loads of dots on there. And there are some little annotations, which actually are nations. And you'll see nations like UK, you'll know that, US, you'll know that. And they're in the top right quadrant of this graph. And the graph represents how many people died from COVID in relation to the preparedness of the countries. In other words, the Global Health Security Index and the Joint External Evaluation Indices, which tell us how much money we invest, how competent we are theoretically in dealing with health crises. And you will see that where we should be, those of us in countries where we have a very high index, in other words, we spend a lot of money, we have loads of experts, we should be in the bottom left quadrant of this slide. We're not. We're in the top right. So the so-called advanced human health systems are actually reinforcing unhealthiness. So this is, I think, an extremely important issue and what I call the COVID paradox. COVID has taught us a lesson. So moving on, we've heard a lot about wildlife, and Steve, quite rightly said, anything new comes from nature. Of course, biodiversity has everything. So even microorganisms and viruses, they come from nature. But if you think that you have much chance of getting an infection from wildlife, think again. It's extremely rare. Again, this is perhaps a complicated graph, but to put it simply, it's a log scale graph because the numbers of confirmed incidents of zoonosis, that is an infection transmitted from an animal directly to people naturally, is so low that we have to use a log. So if you take, for example, rabies, now we get 50,000 odd cases of rabies a year, about 80, 90 cases globally annually come from wildlife. The rest come from domestic animals, from dogs. And so this is a constant theme. Ebola virus, the numbers of actual events where Ebola virus came from some animal, we still don't know the reservoir exactly, is really a couple of dozen. And it's human-to-human infection actually which drives these things, which is rather like COVID-19 as well. So it's a very rare thing actually to get infection from nature. So what we've heard from other colleagues is that it's the destabilizing of nature and the trauma that humans have caused in the world, which is really behind things. But again, I really want to emphasize proportion because a significant part of this risk relates to domestic animals. So if we look at the overall spillover risk, and on the left of this diagram, you'll see a big green bubble. That's actually domestic animals. And in that bubble of animals, you have wildlife. A lot of that is actually not in the wild. A lot of it is in captivity, in zoos, in farms. They're not really wildlife. And peridomestic, they actually live in cities. We have bears in cities and foxes in cities. And from this animal community, we have this movement of microorganisms across into the human domain. About 99% of that is from domestic animals, actually. So zoonosis risk is 99% is from domestic. We often hear this figure of 71% of all emerging infectious diseases come from wildlife, which is correct in its context. It's actually only talking about zoonoses and diseases coming from animals. Actually, a lot of emerging diseases don't come from animals as well. So it's only about 40% of the animal origin diseases that come from wildlife. But some of them are important and some of them lead to major problems. And we can talk about things like HIV, Ebola virus, etc. And so we do need to take it very, very seriously. But we don't look at it in a very careful way. We're very gross in the way we blame wildlife. The other thing to remember is humans. Humans are in huge quantity. And so the risk of microorganisms getting into humans and causing problems is very big. So I'll try and get this to move on. So essentially the common narrative around wildlife and disease is misleading, I think, and reflects ignorance and convenience of blaming other than ourselves for disease emergence. And it really is the human domain which is causing all the problems. And I'll just reinforce this message that domestic animals and agriculture actually to support human beings is really what has crushed nature. It's not poachers, people with bows and arrows. It's actually us. It's human beings and human development which has really crushed nature. And if you look at the proportion of the planet that's left, that's mammals, natural wild mammals, it's about 4%, of which 2% is marine. So really it's humans and domestic animals that have led to this massive destruction. And I'm sorry to say, also cats and dogs. And I'm a veterinarian, so I love my animals, but we must recognize and understand what we've done to the planet. And how are we going to deal with this? We heard about One Health. David is right. Of course, to bring animal people together with human people is really important. But the problem is that the veterinary community is oriented to domestic animals, to animals of economic value. We need a third pillar, which is wildlife people. And that's what I'm arguing about, the Global Wildlife Health Authority. I'm afraid the World Animal Health Authority does not have the disciplines and the expertise to deal with wildlife. And that's been the problem. That's why we know so little about wildlife. We need organizations like the Wildlife Disease Association, like the IUCN, and others who have tried to specialize in this area, get them around the table, get them to talk about really what matters in the wildlife environment. And in the end, with One Health, we've got to get to the deep social, political, economic, and cultural aspects of what drives disease. And it's complex, and it includes capital. It includes where we do things, how we see our future. These are not simple problems. They are very, very complex problems. And we need new institutions. And I know everybody's now trying to grab this space and trying to say that we can fix this. But I'm afraid we really have to go back to the roots, recognize that many of our approach to health is broken. We're over-focused on humans, over-focused on domestic animals, where actually many of the problems exist. And then we see wildlife as this threat. It's no threat. We just have to respect it. And if we do that, as Steve said at the beginning, it will actually keep to itself and things will be fine. Thank you very much indeed to Cornell and to WWF for the opportunity to speak.
Richard, listening to you, I suddenly had a vision of a different kind of Security Council, a UN Natural Systems Security Council. There'd be a giraffe, an elephant, a whale, or whatever. Imagine if they could actually speak and pass resolutions to preserve them and us. I want to move to questions now. David, I know you've got to leave a little early, so I'm going to start with you. I've got a couple here from the audience. We're getting wonderful feedback. The first is that, if you had an extra $1 billion to spend on pandemic relief, how would you spend it?
Well, on pandemic relief, I'd be actually putting all the resources I have in helping to develop rapid diagnostics for COVID-19, and would also want to put similar amounts into diagnostics for other diseases, because I think if we wanted to help humanity to be able to deal with the crushing impact of the current pandemic, the best thing to do is to enable people to be protected. And the best way to do that is with very reliable rapid tests. At the moment, the rapid tests are not sufficiently reliable to be used in settings where the prevalence is low, and the accurate tests are expensive and difficult to administer. That's perhaps a sign also of one of the real challenges in our world today. Most of the extra cash that's come available was put into vaccine development. And whilst that's brilliant, it doesn't actually help poor people now. Poor people would be greatly helped with rapid tests. Poor people would also be helped with improved treatment. That also has been neglected. If I want to stop pandemics coming in the future, I would invest quite strongly in One Health. I would follow the suggestions of the other panelists that I've been on with, and I would focus on wildlife health, no doubt. I would also focus on making sure that the way in which we rear animals domestically, such as farms, particularly farms that are rather surprising, like mink farms and raccoon dog farms and so on for fur, I'd want to make sure that all that system was done much better, with much lower risk of disease developing inside the farms and then spreading across to humans. Lastly, the thing that's most important is just to get systems that enable governments to work together. It's kind of very odd that in this pandemic that we've had in 2020, 2021, the one characteristic of it has been remarkably fractious relations between major powers. When we did Ebola in 2014-15, we had really good relations, and I think that helped hugely. Similarly, when we did the influenza pandemic, H1N1, in 2009-10, it's been really weird. So I would use whatever money I had to try to find a way to make it really difficult for world leaders to snipe at each other. You can't deal with a global pandemic with major nations just deciding they won't cooperate.
David, one more question before we let you go. And again, it's from the audience.
Thank you, sir.
Very specific, so I'd like to get your reaction to it. The questioner asked that I've observed, particularly in Africa, our farming system is a major driver in wildlife loss, so through habitat fragmentation. What is the role of agencies like the FAO and other agriculture support organizations to promote agroforestry as a mitigating farming system to save our wildlife?
Well, I think I would just argue that agroforestry and agroecology and other disciplines that are bringing together agriculture and more sustainable ways of interacting between food production and environmental services, particularly services for wild animals and services that maintain forest cover. These relationships have got to get absolutely massive 100% attention in the coming years, because as all the work we've done suggested that nature is absolutely key to human survival, and work to ensure that nature is given adequate value and support in all aspects of government, civil society, business operations, and more is key. So whether you're in Africa or in Europe or Latin America or in Asia, just let's all be working for a much better valuation of nature, recognition of the role of nature in the lives that we're going to have for our grandchildren and their children and their children. And then thirdly, also recognizing that unless there is a complete shift in the way in which humanity values nature, our capacity to deal with issues like climate change as well as biodiversity loss will be massively diminished. So altogether, I want to encourage all of you to be focusing on what in the United Nations Environment Programme, UNEP, they refer to as sustainable food systems. This year, the United Nations Secretary General is having the first ever World Food Systems Summit to try to raise ambition from nature positive food production systems. I think that this is something worth putting our head and shoulders behind. That will lead to the wider adoption of practices like agroecology, agroforestry, and similar, which will be the pathway to the future. The current hyper-intensive systems of food production are not compatible with long-term future of the planet and need, I'm afraid, to be changed in a very substantive way. Thank you for raising that question, Tom.
David, thank you for joining us. We'll excuse you whenever you have to depart. I want to move to Doreen for a second.
Thank you.
Doreen, who isn't at the table for these kinds of discussions? Do we have the right stakeholders engaged, for success to end the kind of wildlife trade that puts us all at risk?
Yeah. So first, one of the things I would say is generally in a lot of these discussions, you'll find environmentalists are not at the table, in particular ecologists. I've been sitting recently in a lot of One Health discussions with the tripartite partners, with countries, and it's been fascinating to me to see, yeah, there's sometimes a wildlife health veterinarian, but you don't see the ecologists, the folks who really understand how the system works and what the different triggers are. So that's really important. I think who's not at the table as well are these environmental health practitioners that are the eyes and ears on the ground and the different skills, including community representatives who understand what's going on in nature, who can identify things going on and then report that to health, but they're not necessarily talking to each other. And then the last one I would say is Indigenous people and local communities often are left out of the conversation. We try very hard, but it can be very hard to get inclusive conversations. So I think we have to do more. But now I'm going to add, I just thought of one more, the private sector, because I spoke a lot about consumption. Humanity's consumption is driving this risk. And a part of that consumption is a huge role of what private sector plays in enabling and facilitating that. And so we really have to have them at the table as well. This is not just something we can govern our way out of. We also have to look at markets and different kinds of incentives.
I'm not an expert on this at all, so I'm going to ask maybe a stupid question, but who is the enforcement agency? This is a global problem. Depends on global supply chains. It's driven by a global wildlife trade. Who in the world wakes up every day and says, it is my job to police that trade and prevent the commercial exchange of wildlife that can spread zoonotic diseases?
Well, there is no one answer. So for the international trade, we've got a convention, right? We have CITES that plays a remarkable role in looking at how do we regulate international trade and support. At the domestic level,
who is that? CITES? Who is that?
CITES, the Convention International Trade in Endangered Wild Fauna and Flora.
Does it have an enforcement arm?
It has an advisory body, but the member states, remember, it's made up of member states. So member states are responsible for enforcing. There's other UN agencies, such as the UN Office of Drugs and Crime, that are involved. At the domestic level, there'll be different agencies, and that's precisely the problem. You might have an environment authority who's responsible for looking at permitting and traceability for wildlife products, but you might, when it comes to organized crime, have another enforcement arm that's involved. And then certainly you're dealing with goods that are trading across borders. So now you're getting into customs and other different kinds of agencies. And so that is precisely the problem, that it is no one person, no one body. They've got to work together. And improvements in how they work together and how they understand and engage each other is really necessary to address this issue.
You're telling me there's no wildlife Interpol?
There's Interpol who looks at wildlife, but there's no, but there is no separate wildlife Interpol.
Richard, did you want to say something there?
Traffic.
Yeah, Richard,
look,
did you want to say something about
WWF traffic? I mean, we're been hosted by WWF, so we mustn't ignore them. but I think, I think what's actually very important in this debate, though, is I mentioned truth. When it comes to wildlife trade and zoonosis, okay, I'm talking about that. I've been involved with ASEAN. We're doing a situational analysis on this, and actually the disappointing thing, and I know it disappoints a lot of people I speak to, is that we have so little evidence to show that wildlife trade actually is a major source of zoonosis. And I know that's not going to please people, but I'm just telling you what the facts tell me. Why? Because we don't have actually good surveillance systems. We don't have authorities who are focused on this issue. The veterinary authorities are oriented to domestic animals. And we did a rough risk assessment. It's about 3,000 times more likely you're going to get an infection from a domestic animal off the shelf of a supermarket than you're going to get from the wildlife trade. So yes, there's a risk there, without doubt. But we must get the proportions right. We must get the understanding right, because as has been mentioned, many people rely on trade, for their livelihoods or for their well-being. And that there's a danger that the developed world, with all its wonderful ideas and it loves wildlife, it actually causes a lot of harm in some of their policies and narratives. So I just appeal for people to look at the truth and actually don't miss the point that, who knows, if you look at most pandemics, actually they don't come from wildlife. Most pandemics, for example, influenza was mentioned, it's not, genetics come from nature, but it's the actual domestic, so it's pigs, poultry, and humans that drives the influenza pandemic issue. So it's the domestic environment that drives that. COVID-19 is an interesting one. We still don't know. Everybody was jumping on the bandwagon, but actually, as David quite rightly said, is it actually the intensification and industrialization of the fur trade in places like China that might be the key to these emergences of the SARS coronavirus? We could actually forget about the wildlife.
The fur trade?
It just gets on and does its own thing. Sorry.
The fur trade, you said?
Yeah, go ahead.
The fur trade, you said?
Well, yeah, the fur trade, or yeah.
Can you elaborate on
fur
that?
trade.
Yeah,
we're talking.
Let me just try to reframe the question. It's quite remarkable when I think about it that we've had two global pandemics since 2002 that have emerged, one from Guangzhou and one from Wuhan, that have had vast cost in lives and livelihoods across the globe. And we're still not sure where either of them started. How could that be?
It comes down to this. Sometimes there's a very simple story. Let's take Nipah virus. You've heard of Nipah virus. This is, was related to pig farms in Malaysia and bats and fruit trees. And there's still cases of Nipah virus in Bangladesh that occur through people handling fruit that's contaminated by bats. It's a nice, simple story. The virus is present in bats. It's been identified. There's a reservoir in fruit bats. And if you develop agriculture, you create this interface and the virus spills, goes into pigs. Pigs then generate it. It goes into humans, causes encephalitis, and kills people. Nice, simple story. The coronaviruses are not so simple. They're challenging. SARS, we've looked for 20 years. Yes, the virus is in pangolins, in bats, of a particular genetic type, but not the human virus. I don't believe actually it's probably anywhere in the wildlife reservoir, if you like. It's adapted, it's changed, it's new. We can see how quickly it changes. Look at the variants. I'm in Kent, I live in Kent. We have a Kent virus. So you see, when we look at emerging diseases, we forget that things change and viruses particularly change. So I doubt we'll find, if you like, the originator exactly for this virus. It's a human disease. What drives this is human population. It's the aircraft that fly people around the world. It's the lack of preparedness of our politicians. That's what drives COVID-19. And if we don't deal with that, forget the wildlife. So to me, yes, let's use this story to promote improvements in the health sector. But let's not miss what matters, actually. And really, it's in the human domain that we need to really look at, what we're failing at.
If I could just reinforce that.
Please. Yeah, take a swing at that, please.
So I think, again, I said it in my opening comments, these are complex systems and we need a complex system approach to the responses. It doesn't mean we can't break it down into manageable parts. It doesn't mean that we want medical doctors doing veterinary medicine and we want ecologists running around vaccinating people. What it simply means is this coordination, understanding the full scope of the problem, the different entry points. But I think every speaker has emphasized, this is actually not a wildlife problem. This is a human problem that is playing out in a wildlife space. And so the solutions have to be in that human space, in what we want, what we consume, and how we engage with each other.
I couldn't agree more. I think we just need, but as you say, we need to bring to the table people to improve understanding. You see, because there are so few of us in the wildlife field, I'm 40 years in this business, and it's a lonely business because, the Wildlife Disease Association, which is global, has 1,500 people. Do you know how many dentists there are in the world? We're struggling. We're trying to bring knowledge to the table, but we get drowned out, actually, by a narrative that's created by people with computers stuck behind desks somewhere in cities. And so, we need to get back to the roots. We need to get back to wildlife managers, ecologists, indigenous people, and so on, who work very closely with these animals. And I've been very privileged to have worked in the field a lot of my career as a wildlife veterinarian. And so when I hear a lot of the narrative, I go, hang on, this is not reality. We need to get this, but we have to get around the table. And as David says, it's no good doing this in isolation. We have to bring people together. And I'm so pleased UNEP, is now involved, because I've been arguing for that for years. I was involved with their Geo6 project, which was all about health, funnily enough. And it was great working with these people. But what was clear to me is that there were too few of us, and too little understanding.
Are we letting China off the hook too easily? Two of these pandemics, one came out of Guangzhou, one came out of Wuhan. Does it owe us different practices around wet markets and the expansion of urbanization into wildlife areas?
I'll answer the question about the markets. As you know from the WHO mission that came back, they didn't have any answers. And in fact, zooanthropognosis, this reverse zoonosis, I mentioned it in my talk, and I know it's a difficult concept, but actually, all the virus that was present in Wuhan market could have come from people. Interesting. We know the Beijing market ended up with virus from people, probably. It was on fish, I think. If you go to many of the meat processing plants around the world, since COVID-19 has been present in humans, you find it in the animal meats, because it's an ideal environment for the virus to survive. So we actually don't know if the virus came from that Wuhan market. So when the Chinese say, actually, it could have come on frozen pig heads that come from Thailand or from the United States, it could have done. I don't think we have enough knowledge, actually. But the assumption was made very, very early on. And of course, going back to the SARS, again, it had links to markets. But these are places where people concentrate, where you get if you have virus, it gets spread very quickly and it survives because it's wet, it's often kept cool, and it's ideal for viruses. So I think we have so much to learn, and that's what I mean about truth. We jump to conclusions. We need to get more science, to look at the processes, the pathways by which these viruses actually emerge and evolve. And I just appeal to people, to encourage research in the right direction. Don't leap on a particular agenda and start claiming that it's because of bats or it's because of this, because actually the evidence is not strong enough to be able to go out there with a spray can and kill bats. It's wrong to put that message out. And I'm really passionate about that.
No, and I couldn't agree more. The science, we have to follow the science and invest in the evidence base. And zoonoses occur everywhere in the world. So it's really important to recognize that as well. But the reality is we're in a pandemic, so we're in it together. So multilateral approaches, coordination are the way out of this mess, whatever country you sit in.
Very interesting.
I wouldn't blame China.
Go ahead.
I definitely wouldn't blame China, and I'm sorry. I'm not going to cast aspersions on your earlier president, but to blame people and to say China has done a lot in the environmental field, which is, I believe, wrong. But I think they understand that. There are a couple of billion of them, and they've been trying to survive. So, I understand it's a huge challenge. There are no freshwater fish. I heard today, people are saying, well, the freshwater fish are about to all go extinct. Well, China's, not had any natural freshwater systems for a long time. Okay, so they understand the challenge. They know what environmental degradation means in a place like China. They plant more trees than anybody else in the world. So I'm not, look, I think to blame people is absolutely wrong. We should look at ourselves as human beings, actually, just across the world, and say, as Doreen said about consumption patterns, where the fault lies is in selfishness and greed, and in societies that are complacent and arrogant. And we often criticize others when we feel we're so smart. But I just appeal to people: humility, respect. And let's learn and let's understand, and then let's find solutions to this problem. We can. I'm absolutely sure we can, because we've caused the problems. So let's just recognize that and begin to find solutions.
Well, there's a lot of individuals watching us right now, not only people associated with wildlife organizations. What can I, Tom Friedman, individual, living in Bethesda, or Sue Jones living in Nairobi, or Wang Yang living in China, what can we as individuals do?
I'll jump in that first. I mean, the first thing is, again, we've talked about a global connected system, and overconsumption is driving this destruction of nature. So first, we have to educate ourselves about the things we want, the things we consume, and where they come from. And so that's really important. Making smart consumer choices, being a part of a circular economy, really looking at what do we actually need to live our lives is incredibly important, because you don't realize what you're buying in the supermarket in New York or in London or wherever you are actually has a huge impact around the world. So understanding that impact, sometimes that impact's good, sometimes it's very bad. So I think that's the
Doreen,
first
if I could just interrupt you there, it'd be very interesting if we had packaging that didn't just say calories, carbohydrates, but this is the supply chain for this meat, this food, this grain, whatever. So interesting. Go ahead. Sorry.
But the other point I would say is, we discovered in our report, some people consume too much. There are people on the planet that consume too little. So we also have a responsibility as individuals to demand, to call on governments to take care of those who are most in need and make sure our consumption, our needs aren't actually harming others. And that includes other species. And so I think we tend to live in a very human-centric world, but the reality is we don't live unless we have a planet that's functioning. And so we have no choice but to get smarter about our choices and smarter about demanding accountability of our governments as well, in terms of how governments invest and how governments partner around the world and how governments choose different development pathways. And that's the last point I'll make. This destruction of nature that is increasing zoonotic risk. We know that fragmentation of habitats in many cases actually increases risk for emergence of zoonotic diseases. That fragmentation is often not caused by food consumption. That's caused by logging roads. That's caused by different products we're trying. We're cutting into forests to extract things in a way that isn't sustainable. It's demand for housing. It's demand for transport. So it goes beyond just what we're actually putting in our mouths. It's about how we're living on this planet. And again, we have to get smarter and engage within those sectors. And there is a role for government as well as for the individual. And again, for private sector also to step up and recognize that its footprint has to also be smart on this planet, because there's only one.
I want to bring you back. Just hold on one second, Richard. I want Steve to come back in. Steve Wasowski. Steve.
Hi. Great discussion. I just wanted to react to a few things. I think the emphasis on science is obviously critical to all of us. And I think we know just from the genetics alone that these recent outbreaks, SARS-CoV-2, you know, they did come from wildlife. But I think it's important, as you guys have been discussing, the movement of the virus is often in people once we've had that jump. And so one of the things, and this is really in a way a discussion for you, Tom, given all of your writing on globalization, when I think about a market, wherever it is in the world, and the price of a pound of wildlife species X that you buy in the market, the real cost of a species being sold that is likely to potentially, more likely than others to carry a virus, like a bat, for example, that the cost of a pandemic risk is not borne in that transaction. So if that piece of meat costs $5 a pound, but the risk to all of us is more like $10 million a pound, we've got a problem. We've got an economic problem. And so I just wanted to make sure we were thinking about what happens, even with entirely in the borders of one nation, can affect all of us. And part of it is a failure of economics to incorporate this risk. These risks are not an externality, and yet we've been treating them like one. And I don't know if, Tom, in your experience, you can say anything about that.
Well, you know, what I'd
Absolutely.
say, Steve, is this, that it's a really good question. If I look back on the last 20 years of what I've been writing about, actually, all I've been writing about is pandemics. But they come with different pathogens. One was a geopolitical pandemic. It was called 9/11. One was a biological pandemic. It was called SARS-CoV-2. One was a financial pandemic. It was called 2008. And one that we're now facing right before our eyes is an atmospheric pandemic called climate change. Now, what's really interesting, if you look back at the last 20 years, Steve, is that each of these pandemics started with a warning heart attack, and then we got the full coronary. So in 1993, a guy named Ramzi Youssef tried to blow up the World Trade Center. It didn't work. 2001, we got the full coronary. In 1998, a hedge fund in Connecticut called Long-Term Capital Management managed to amass $1 trillion in leverage, almost blew up Wall Street. That was the warning heart attack. In 2008, we got the full coronary. In 2002, SARS-CoV-1 emerged in Guangzhou. A doctor left there, went to a hotel in Hong Kong, checked into room 911, couldn't make that up. And in 2019, we got the full coronary. And of course, every day we're getting the warning heart attack about climate change, with the added concern that there is no herd immunity to climate change and there's no vaccine. So why is this happening? Well, you know, a lot of people, Steve, will ask me, hey, Friedman, is the world still flat? To which I answer, oh, baby, it is flatter than ever. The reason this is happening, and Richard alluded to this in his comments, is that basically what we've been doing is actually we've connected more nodes in the world than ever before. Remember something, Steve, when I wrote The World is Flat in 2004, Facebook didn't exist. Twitter was still a sound. The cloud was still in the sky. 4G was a parking place. LinkedIn was a prison. Applications were what you sent to college. Big data was a rap star. And Skype, for most people, was a typographical error. None of those even existed in 2004 when I say, hey, the world is flat. So we've connected so many more nodes around the world. Then we've greased the connection between those nodes. You know, when you had 3G on your computer, it took you 2 hours. It took you 6 hours to download a 2-hour movie. Under 4G, it took you 2.6 minutes. Under 5G, it will take you 2.6 seconds. So between December 2019, and Richard alluded to this, and March 2020, there were 3,200 direct flights between China and the United States. 3,200. There were 50 direct flights between Wuhan and the United States. Wuhan. How many Americans had even heard of Wuhan? So we've connected the world, made it flatter than ever. We've greased the connections between these nodes. And then we've done what all the panelists have been talking about. We remove the buffers. We remove the buffers and surge protectors, whether it was rainforest, whether it is trees, whether it is mangroves, whether it is financial regulation around transparency and leverage, whether it's cultural diversity in the Middle East. These are all different forms of buffers. So when you connect the world, you grease the connections, and you remove the buffers, you really get a world where pandemics are us: political, economic, biological, and atmospheric.
Yeah, and I think that's what we're talking about, right? Resetting those buffers.
Right.
And in making sure our investments, absolutely, we've got to put it back in place.
Yeah. I now know why I read the New York Times. It's good to hear, good sense.
Yeah.
And you asked that question just very quickly on, what can we tell ordinary people? Well, I've thought about this a lot, and in relation to this issue of animals and environment and climate change and pandemics and all that sort of stuff. And frankly, the only thing we can do, and I think it's very possible, is to reduce our meat consumption, maybe by 75%. If we did that globally, we would release huge amounts of land.
Richard, I didn't hear that. Could you repeat that 75%? I didn't hear that because someone was in my ear. Yeah. What did you just say? The 75%?
I was saying that, something, a very simple thing we can do without actually not eating meat. I mean, we can reduce meat consumption as an individual by 75%. That's all. Go back to having chicken on Sundays and not every day of the week. That could make a massive difference. Because the amount of land that is used actually to grow the crops to feed the animals. We grow crops to feed chickens. Chickens are like us. They're simple stomached animals. Why do we do that? It's madness. We should just eat the plant material. So that's my last word. Thank you very much.
No, Richard, we're going to bring Nick back in here. Nick, I want you to pick up on a point that Richard raised, and I'm very interested in it and humbled by it, because the way political debate works today in general, and in the last 4 years in America in particular, was simplifying things to their most crude level and then amplifying them through social networks. So Nick, just pick up on all of those themes if you would.
Thank you. It's an incredibly complex milieu. And you've spoken about the complexities that made it in our world today, that made it easier for this pandemic to take hold. You talked about the connectivity between China and the US, amongst other things. But actually, the root causes of this pandemic, I mean, they're rooted in a real conjunction of pressures that we're placing on nature. And I think that, Doreen, is a point that you've just made. And I think that adds a complexity to this, which makes it difficult to address. And I think going back to the conversations I had with colleagues at the UN during the Ebola outbreak, it was said, well, this is too hard to fix. The chances of this happening again are quite, minute. So it's going to be too costly to try and do something about this now. And so they left it off the table. The fact is that although the risk of an individual spillover from an animal to a person can be infinitesimally small, once it happens, the impacts could be horrendous. And I think we're seeing that with this in this particular case. And so, the cost benefit calculus, given this complexity, is an incredibly tough one.
Mm-hmm. But Nick, can I say, it's too hard to fix. It feels hard to fix, but it's too dangerous to not try and fix it. And that's where we're at right now.
No, just to conclude, I just in listening to you all, and it's been a fantastic panel. I just think of that mantra we have around climate change. We need to avoid. We need to fix what is unavoidable and avoid what would be unfixable. And that really is the challenge we face, not only in confronting climate, but this whole challenge of zoonotic disease. This was a terrific morning session. Steve, congratulations on getting this started. We're going to take a 15-minute break now and come back at 10:30. So we'll see you all back then. Hi, and welcome back to today's event. We're discussing and exploring ways to prevent future pandemics by addressing global governance of wildlife trade and consumption. And that's going to be what we're really going to zero in here on the second half. My name is Thomas Friedman. I'm your moderator. I'm a columnist for the New York Times. If you have a question you'd like to ask during my upcoming conversation with a panelist, please use the Google form below the video player in your web browser. Our team will be monitoring your submissions throughout and will address as many as we can. And now I'm delighted to welcome our next esteemed panelists, beginning with Dr. Teresa Mundita Lim. Dr. Lim is the Executive Director of the ASEAN Center for Biodiversity, ASEAN being the Intergovernmental Association of Southeast Asian Nations. I know it's late for you there in Asia, Teresa, so thank you very much for joining us, and please welcome.
Thank you very much, Tom. Good evening from Manila. It is both an honor and a pleasure to be here with everyone. Good morning and good afternoon to the rest of you who are not in the same time zone. Almost a year since the pandemic struck, the connection between biodiversity loss and the emergence of zoonotic diseases such as the COVID-19 has gained wider attention. Biodiversity has been talked about more often as we all make sense of the crisis and establish clear paths to recovery. Earlier, we heard from Dr. Navarro about how a holistic, interdisciplinary, and integrated approach helped address the bird flu in 2003. This One Health approach is particularly relevant and crucial to a biodiversity-rich region such as Southeast Asia. The Association of Southeast Asian Nations, or the ASEAN, has 3 of the world's 17 mega biodiverse countries and 5 countries in the Indo-Burma region, considered one of the most biologically important regions on the planet. Despite comprising only 3% of the world's land area, the region is home to 18% of all known plants and animals. The richness also makes the ASEAN vulnerable to the spillover of diseases from wildlife to domestic animals and to humans. Species that have been implicated as the origins of COVID-19 and other new and emerging diseases thrive in the region. For instance, the highly pathogenic H5N1 influenza, which broke out in humans and domestic poultry in Southeast Asia in 2003, has been found to occur in a number of healthy-looking wild bird species, including the tufted ducks, which are present in the region. In 2015, my former agency and I were part of a multidisciplinary and multi-institutional team that investigated bats as possible reservoir of the Reston Ebola virus. We found both molecular and serological evidence of the virus in multiple bat species. Also, just this month, researchers in Thailand published a study on the presence of SARS-CoV-2 related viruses among Southeast Asian bats and pangolins. With 346 bat species, 3 species of pangolins, and over 2,000 migratory avian species, the ASEAN could be a hotspot for the next pandemic. But I also agree with Dr. Ka that while pandemics may originate from animal reservoir, the emergence is driven by anthropogenic factors which create opportunities for the transmission of virus from wildlife to domestic animals and to humans. If we hope to avoid experiencing another pandemic together with its consequences, I would like to highlight several key measures that could very well form part of our approach towards recovery and building a better and healthier future for all of us. First, protecting the wildlife species through species-specific conservation actions. Robust mechanisms for implementing wildlife laws that address illegal and unsustainable use of wildlife at the local, national, and international levels are favorable in keeping the species safe in their natural habitats. Reducing contact of natural hosts with multiple varieties of other species, including domestic animals and humans, lessens the opportunities for viruses to transform. Second, conserving and restoring ecosystems and wildlife habitats. Deforestation, habitat fragmentation, which have all been mentioned earlier, encroachment, and land use change put great pressure on ecosystems and displace wildlife populations. driving them closer to human settlements and exposing them further to poaching and man-made hazards. Protecting high biodiversity areas that are likely natural habitats and home range of natural reservoir of potentially disease-causing viruses must be part of an integrated approach to preventing future pandemics. In the ASEAN, there are more than 2,600 protected areas, and 50 of these are considered regionally important. These 50 are the ASEAN Heritage Parks, or the AHPs. 7 of these AHPs have cave ecosystems which serve as important bat habitats, not counting the forest areas that are roosting sites that are vital to sustaining bat populations. A number of AHPs as well have wetlands that are watering and feeding areas for migratory birds. The entire ASEAN region is part of the East Asian Australasian Flyway, and ensuring the health of wetland ecosystems will allow a robust and stable water bird population that can help keep viruses in check. Lastly, and this was mentioned by Doreen earlier, an effective approach in preventing pandemics takes into account the crucial role of indigenous peoples and local communities in caring for and protecting our natural resources. These communities, along with the local and indigenous knowledge associated with the natural surroundings in which they live, must also be part of our new approach. Their presence within and around the habitats make them indispensable frontliners in safeguarding biodiversity. Through a connection that has been forged through time, indigenous and local knowledge systems that are built around a harmonious relationship with nature are essential in ensuring resilience and sustainability. Together with environment-friendly innovation and technologies, traditional and sustainable practices that have been passed on from generation to generation must likewise be incentivized and recognized to instill renewed pride and deliver added benefits to those who apply them. In the short term, economic stimulus and biodiversity-friendly livelihood programs for communities in and around protected areas and wildlife habitats, especially during this crisis, can substantially help reduce the pressure to exploit and overutilize natural resources. Let me stress that we do not need to reinvent the wheel to ensure a sustainable future for wildlife and humanity. The solutions in averting pandemics and building our resilience may not necessarily be found in another planet, but here among us, in nature, in our biodiversity. In November of 2020, the ASEAN leaders adopted the region's comprehensive recovery framework, which includes guidance in advancing nature-based solutions to increase the region's resilience to crises, such as disease outbreaks. The implementation of the ASEAN framework will require a whole-of-community approach, a cross-sectoral collaboration, including mainstreaming biodiversity across relevant sectors, and encouraging a change of behavior that addresses the root causes of the pandemic. The mass rollout of COVID-19 vaccination may have given us confidence that the end of the crisis is almost in sight, but we should never lose the learnings and warnings of this pandemic, and that this may not be the last. Our new approach must not consider this crisis as a single event, but part of a recurring challenge that needs us to recognize that people, domestic animals, wildlife, and environments are interconnected. Thank you very much, and good day.
Dr. Lim, thank you very much. Our final panelist for this session is John Scanlon. John chairs the Coalition Global Initiative to End Wildlife Crime, and he served as the Secretary General of CITES, the Convention on International Trade of Endangered Species, from 2010 to 2018. John, take it away.
Thanks very much, Tom, and thanks to the organisers for hosting such a thought-provoking event today. We need to recalibrate our relationship with nature for many compelling interrelated reasons, including to protect biodiversity, combat climate change, and to prevent future pandemics. We need to rethink how we trade, market, and consume wildlife, be it legal, illegal, regulated, or unregulated, recognizing that wildlife issues are bigger than conservation. They're also about public and animal health and welfare, and if we get it wrong, it can have massive global implications. The fact that viruses can spill over from certain wild animals to people through wildlife trade, markets, and consumption is now very high in our collective consciousness. And the UN IPBES tells us that 1.7 million undiscovered viruses are thought to exist in wild animals, about half of which could spill over to people. Now, there's an old saying that we're all familiar with: prevention is better than cure. And we need to take heed of what scientists are telling us, and this includes re-evaluating our current international legal framework to see if it is still fit for purpose in a post-COVID-19 world. So, are our current international laws fit for purpose? And the short answer is no, they are not. Our current international regime for regulating wildlife trade and combating wildlife crime, including illegal wildlife trade, is inadequate, both for regulating the trade markets and consumption that pose a risk to public health, as well as for ending wildlife crime. And if we hope to prevent future pandemics, then profound changes are needed in how we regulate the taking, trade, and consumption of wildlife, and how we combat wildlife crime. We also need to better manage and finance the protection of wildlife at its source. Now, there is much to be done, and this is apparent from Theresa's remarks. But today I will focus my remarks on two serious gaps in the international legal framework that leave us exposed to future pandemics, namely how we regulate wildlife trade and how we combat wildlife crime. Now, these are challenging, global, interconnected issues. Viruses can spill over in any country, and wildlife crime is a scourge affecting every continent. A collective effort is needed to address them. Now, looking first at legal, regulated, and unregulated trade. CITES, the Global Wildlife Trade Regulator, is a convention that was negotiated and signed in the early 1970s. It was designed to address the overexploitation of wildlife through international trade. Now, it's not perfect, but it does this quite well. But CITES was never designed to address the public and animal health aspects of wildlife trade. It addresses the impact of trade on the survival of a listed species at its source, not its potential impacts on human and animal health once taken and transported to other countries. Now, this narrow focus on overexploitation was sound when the convention was signed back in 1973, but it cannot be sustained in a post-COVID-19 world. Today, it is imperative, as we have heard, that we take a One Health approach to wildlife trade and related issues. Now, human memories are short, as is clear from the responses to previous pandemics. And to succeed, we must hardwire a One Health approach into the international legal framework. Now, there are several viable options available to achieve this objective, but time prevents me from discussing them all. But the most effective and cost-efficient way is for states to adopt amendments to CITES that build public and animal health criteria into its decision-making processes and to extend its reach to wildlife markets and consumption. Now, our initiative has drafted what these amendments could look like, and if adopted, they would embed taking a One Health approach into the international legal framework, and thereby make CITES a contemporary convention and one that will help prevent future pandemics. Now, turning to wildlife crime. These are crimes that can pose a threat to public and animal health, but they also deprive governments of revenue. They drive species towards extinction, degrade entire ecosystems and their ability to sequester carbon, and they exacerbate corruption, insecurity, and poverty. Now, illegal trade in CITES-listed species is said to be valued at about $20 billion annually, but CITES only covers just 38,000 of the world's 8 million species. And if we consider all species, including fish and timber species that are being trafficked and its impacts on ecosystems and lost government revenue, then the World Bank puts this figure at a staggering $1 to $2 trillion a year. Now, CITES has been heavily relied upon to date, but it was not designed to deal with wildlife crime. It's a trade-related convention, not a crime-related convention. However, in the absence of any other instrument and facing a surge in trafficking, we made the best possible use of it. But we've stretched CITES' mandate to the limit, and we now need to do much more. Further, in response to the COVID-19 pandemic, we are already seeing more local restrictions placed on wildlife trade markets and consumption that could pose a risk to public health. And this trend is set to continue. However, for these measures to be successful, such high-risk activities must not simply move underground, and preventing this will require a scaled-up collective enforcement effort. Now, notwithstanding the destructive and high-risk nature of these crimes to both people and wildlife, there is no global agreement on wildlife crime, as there is, for example, on human trafficking. Humans and wildlife are losing. And the stark reality is that left as it is, our system is not going to end these crimes or work to prevent the next pandemic. We need to address all species that are being trafficked, not just the limited number of species protected under CITES, and to embed preventing and combating wildlife crime where it belongs, namely into the international criminal law framework. States can do this by developing a new agreement, namely a new protocol on wildlife crime under the UN Convention Against Transnational Organised Crime. And our initiative has drafted a possible protocol. And if adopted, it would embed combating and preventing wildlife crime into the international criminal law framework. It would apply to any species of wild animal or plant, including fish and timber, that is protected under any international and, importantly, any national law. Amongst other matters, it would make it a criminal offence to import any wildlife or wildlife product into a country if it had been acquired in contravention of the national laws of the source country. Now, this would represent a remarkable expression of comity between nations, namely a mutual respect for one another's laws. And adopting such a protocol would be the first time that a crime that has a significant impact on the environment is specifically embedded into the international criminal law framework. Colleagues, looked at overall, left as it is, our system is not going to prevent the next pandemic. It could in fact be raising our potential exposure to zoonotic diseases. CITES was groundbreaking in its day, and our predecessors showed great ambition and courage to negotiate such an agreement in the 1970s. But it's now 2021, and CITES has become dated. Today, the world is feeling the full brunt of a pandemic, which most likely had its origins in wildlife. And we are advised that there are hundreds of thousands of viruses that could spill over to humans. Given the scale of the risk to people and planet, we simply cannot allow a wildlife trade regime to prevail that fails to include public and animal health into its decision-making, nor can we stand by and watch the wildlife crimes continue to escalate without ratcheting up our international response. The world's youth is taking a massive hit from this pandemic, and we owe it to them to act boldly and swiftly to ensure that we pass on a legal framework that is fit for purpose, one that gives us our best shot at preventing future pandemics and all of the misery that comes with them. Colleagues, it's time to stop continually calling for transformational change and to start acting on it. Thank you.
John, thank you very much. And Dr. Lim, thank you as well. It's very, very interesting to me. You know, as someone who covers international relations, I could only think, listening to you, John, of we have a nuclear non-proliferation treaty, blessedly, to prevent the spread of nuclear weapons, and it's worked, you know, fairly well. But we have really none to prevent the spread of these kind of zoonotic diseases, which have now actually touched our lives much more than any nuclear event. I guess we should be thankful for that. But I guess my first question, and I want to bring Nick and John back in to join the discussion here with us. My first question to you, John Scanlon, is how hard would it be to get the United States, Great Britain, France, Russia, and China, just thinking of the Security Council members, for starters, how hard would it be to get them to back this kind of treaty you're talking about?
Thanks, Tom. You know, what I think is interesting is to cast our minds back and think back into the early 1970s when CITES was negotiated in the first place. It was actually negotiated at a plenipotentiary hosted in Washington, D.C. That was at the height of the Cold War. At the height of the Cold War, the CITES Convention itself was negotiated. And I think if you look across time over the last 50 years, the world, despite a lot of periods of conflict and geopolitical tensions, has come together to address issues of common interest where it's been needed. Now, we clearly have here an issue of common interest that needs to be addressed. We're all experiencing the impacts of this pandemic. It would appear to have its origins in wildlife. We know of the risk that exists out there of future pandemics emerging from wildlife. It's in everybody's interest to come together and take what steps need to be taken to prevent future pandemics. So I look at it quite optimistically in the sense that I think history's on our side. We've seen good international agreements be negotiated, concluded, adopted, come into force during times of tension in the past, and I'm sure we can do it again.
Let me just follow up just very quickly. Give me an example, give us an example, John, of what would be a codicil of such a treaty, and how might it have helped us prevent this pandemic?
So what we tend to do here is a lot of questions come about looking back. Could we have prevented what happened? What we're trying to do is look forward. So the jury is still out on the exact origins of the COVID-19 pandemic, although it would appear to have emerged from wildlife. But what's become apparent through investigating or finding out what were the origins of this pandemic is the science that's become available. We have so much science now that's been produced or is available, or gaps in science we're told about. We know that there is a real risk in the future of pandemics emerging from wildlife and the way in which we interact with wildlife. So the issue for us is that, do we want to expose ourselves to that risk? Even if the risk is marginal, the impacts of just one spillover of those hundreds of thousands that I talked about is massive. The cost of negotiating a new regime for wildlife trade and wildlife crime and implementing it pales in comparison to the cost associated with just one pandemic. So it's really taking a precautionary approach, looking forwards. How do we have a system that's fit for purpose so that we can do everything that we possibly can to prevent future wildlife-related pandemics? Here are two things we can do, very pragmatic, very operational, and the benefits are multiple. The benefits are to biodiversity as well, to climate change, to regional security, et cetera, et cetera.
Terrific. Nick and John, please dive in.
Steve here. John, we're totally on the same page. That's fine. So we're totally on the same page in terms of the crisis that we're in, and we've got to take advantage of every lever arm we can pull. Can you say, obviously we don't want to get too far into the weeds, but can you say more about, the types of species that are likely implicated, particularly, rodents, bats, et cetera? How do you envision CITES accounting? If 25% of the world's 4,000-ish mammal species are bats, how would this agreement, this modification, address that? How does this not get blocked by what has been a significant bureaucracy within CITES?
So if we just look at the CITES amendment there, at the moment, as you know, CITES only lists a species or brings a species under its trade controls based on conservation grounds. They look at the biodiversity, the biodiverse issues, and the issues to do with trade. They have no account of whether or not that species in trade could pose a risk to public or animal health. So what we're saying is you have to adjust the criteria. You can list a species not just because it's on conservation grounds, but because it could pose a risk to public or animal health. Now, there are some species that are obvious, you referred to them. For example, the horseshoe bat, which is often implicated as the starting point for this virus, is not listed under CITES. It doesn't meet the conservation criteria. Most bats are not listed under CITES. If you made this amendment, first thing you do is probably list all bats. But we have to look back in history as well. When CITES was adopted about 50 years ago, we didn't know what species were going to be listed from a conservation perspective. The science was evolving, it was maturing. It's still getting better on the conservation grounds. Here, if we say we need to list species on the basis of the risk they pose to public or animal health, that science is evolving as well. But you will have institutionalized this so that going forward, you have a mechanism, a science-based mechanism, an open and transparent forum for deciding which species should be considered and which species should be listed. And that science will evolve over time. But I'd say there's some candidates right up front that you want to list straight away and say you would not want those species in trade or markets and consumption without considering the public and animal health risk. And what we've proposed is you look at conservation, public health, animal health. There's no trade unless all three agree.
Dr. Lim, from an ASEAN perspective, do you think this is something ASEAN governments would would welcome, embrace, and what would be some of the maybe the political challenges for a group like ASEAN to join in the kind of global new convention that John has outlined?
Well, at the moment, there was already a Chiang Mai statement of ASEAN ministers in March 2019, and in that declaration, the ministers already they already stated that they want to enhance global support for efforts to combat poaching and trafficking of protected species. So there is some solidarity in ASEAN on addressing illegal wildlife trade. But as to the proposal that was presented by John, for example, this is something that still needs to be further discussed. At the moment, there's a will of higher authorities, of decision makers, the ministers who are in charge of wildlife. There is a will to really address the illegal wildlife trade at the core. Even the statement mentions capacitating local communities to pursue sustainable livelihood opportunities. So these are all part of the equation for addressing illegal wildlife trade in the ASEAN. And and so the political will is already there through the statements that have been issued by the ASEAN ministers responsible for enforcement on illegal wildlife trade.
Let me ask, so what about at the popular level? I mean, there's a lot of commercial wildlife trade in and through and between ASEAN countries. How do you think this would play at the local level on Main Street?
It's the good thing about ASEAN is when the leaders speak, the people already know that that's the direction that we are going to take. It takes time for implementation, but for as long as there's already that general guidance, then it's really up to national governments and to the centers like us to be able to support the implementation of some of this guidance from the leaders and from the ministers. So it's it's also there are also some there also, and we need to take into account as well traditional uses as differentiated from illegal or unsustainable utilization of wild animals and plants, for that matter.
Thank you, Nick. Please jump in.
Yeah, I'd like to just stand back and look at the big picture. First of all, maybe to present a 3-point plan for action. First of all, we need to address this as a global community. This is a global problem. Although it appears that COVID-19 originated in China, the so-called Spanish flu, emerged after the First World War, seemed to have its genesis in Kansas, and that was a bird flu. It is true that ultimately the issue is whether or not a zoonotic disease spillover leads to a pandemic. It depends on the transmissibility of the disease person to person. And so the risks are different in different parts of the world, and we do need to have tailored solutions, which brings me, I think, to the second point. We need, beyond the global framework that John spoke about, we need national frameworks. We need strengthened national policies. Now, the Chinese moved quickly. In February last year, they introduced a ban on the consumption of most wildlife. And as I understand it, that ban is permanent. Now, they'd done something similar during the SARS outbreak, but it was a temporary ban at that time. And so now they've gone permanent, and I think that is a major step. Vietnam has similarly issued restrictions. I mean, there are ways to go before those are fully implemented, and so on and so forth. Which brings me to the third level, which is what do citizens think, and what does it take to get the groundswell of support and the behavior changes needed from communities writ large. Now, we at WWF, working with GlobeScan, have undertaken a number of surveys in South and East Asia looking at community perspectives on this matter. And what we found is 93% of the respondents want some kind of action to take place. They recognize the risks. And by the way, and speaking to an earlier point, China wouldn't have taken the steps it did in terms of banning consumption were it not for the fact that they recognized there was a risk, in the consumption of wildlife. And so, although that risk might be small and in terms of an individual event, in terms of consumption, taken together and collectively at the scales we're talking about, it is massive. So I think there is scope for action here, with the groundswell of support, but understandably, it's now during the midst of the pandemic, that will taper off going forward. So we need to be smart about this and to keep up the momentum. One final point in this context is we need to understand what kind of behaviors need to be shifted, because it's not just reducing the consumption of, say, bats or certain taxa, which are potentially very high risk. It's also around changing our animal husbandry practices. The Nipah virus happened as a conjunction of how pigs were farmed in Malaysia, and using mango trees, fruiting trees, as sort of locations for pig pens, putting them into close contact with fruit bats also feeding on the mangoes. So we need to change those sorts of arrangements, not just the arrangements of, which lead people to consume wildlife.
Steve, I heard a new term, so I love doing these things. I get to learn so much. And I heard a new term from John, a One Health approach. Pardon my ignorance, but would you explain what that means?
Sure. I think we've heard from a number of speakers. One Health really speaks to recognizing the relationships between our own health, the health of our domestic animals, the health of wildlife, and how all that is underpinned by environmental stewardship. And our international organizations, our bureaucracies have tended to be siloed. You have FAO that's working on agriculture, WHO working on public health, et cetera. And the One Health approach really is a remedy for breaking down these silos to encourage the type of collaboration that's needed. And I guess, I think Nick just made some really important points about, national as well as international arrangements. And I think, again, a lot of this comes down to incentives and economics. So if you are, say, a large logging company or a mining company, and you're, making revenues doing those undertaking those extractive activities, but the risks of disease emergence are not borne by your company. They're not on your ledger. That's where we find ourselves. And that's why we're starting to think more and more about a more holistic accounting, where we can try and extrapolate, based on previous experience, and look at what are the likely real costs to public health of environmental incursions, whether it's road building across the Amazon or mining in the Congo Basin or extractive industries in Montana. We've totally ignored the public health ramifications of those activities, not just in terms of emerging disease, but also in terms of water pollution, air pollution. We've accepted all that as external to the primary drivers, and that's been the fundamental flaw of our economic system. And while we're paying the price, as John alluded to, as many of the speakers alluded to, in terms of trillions of dollars of impact because of the pandemic. I guess related to that, John, just to tease out a bit more of your concept, if we think about CITES, we really think largely about international trade. How does the change that you're advocating for address activities specifically within one nation's borders? There are sovereignty issues. Obviously, as Nick said, China's recognized the threats that some of the wildlife-related activities have posed, but is the way you're envisioning a future for CITES going to impact trade and markets within a country, even if there's no international commerce involved?
Yeah, thanks for that. And what I've been talking about is having a common framework that can help guide the way in which we're going to operate at a national level. And as you've said, and as others have said, it's not just one country that needs to act here, because a virus can spill over from any country, from within any country. So we need collective action. And so that's why we need to look at our international framework so that we have some common ground rules about what the risk is and what we would do collectively to mitigate that risk. But then each country has to implement that, and it may want to go further. And what we've seen, and Nick just mentioned this in terms of China, they've gone beyond what's required by international law, and they've been closing down markets and prohibiting consumption of wildlife because they obviously view this as a risk and they're going to close it down. What we've proposed with CITES goes a little bit beyond the existing framework, not only in terms of public and animal health and taking these criteria into account, but the way in which the amendments we've drafted have been put together. It would also allow parties to address issues to do with markets and consumption if they thought it was necessary. So we've gone a little bit beyond where the current outreach of CITES is in terms of the way it currently functions, just looking at the conservation aspects of trade to enable some further, if you like, effort to be applied to markets and consumption. So it goes a little bit beyond what the current framework is in that sense. But we really do, we need a good international framework so that we can take a common approach to this. But at the end of the day, exactly right, you have to have strong national frameworks and implementation to give effect to it.
Dr. Lim, how you raise this very important point. There's so much knowledge among Indigenous people about all these problems we face. How can we bring them into the discussion in a systemic way and leverage their wisdom?
We have, well, in the Philippines, there are projects where, you know, we recognize traditional practices for managing rich biological areas. These are called indigenous community conserved areas. There are also certain, you know, it's just recognizing that there are certain knowledge and practices that are friendly to biodiversity, and looking at those practices and trying to mainstream them into society. So these are just some of the steps that recognizes the, and then also even in the mainstream protected area management, there is representation of indigenous communities in the governing boards. And those are ways to be able to listen to what they think and to listen to the recommendations on you know what the best ways of managing certain areas, the way their ancestors used to.
You know, Nick, both you and Steve have talked about the siloed nature of this problem, the way we've dealt with it up to now. Silos are tough. We've learned, you know, it's one thing to identify them, another to break them down. Talk to me, Steve, join in, John, join in. How do we go about breaking down these silos? It seems to me the critical question here.
Well, let me jump in first. I'm actually quite hopeful because the situation we see today is very different from that we saw at the time of the Ebola outbreak in 2015. There, although people like David Quammen and others were talking about these risks, it just didn't have much global currency. We just unlike today, where I think, you know, this has become a commonplace conversation, and it's an important conversation to have. It's a conversation that we need to have as we move towards recovery efforts. You know, countries have been affected globally, economically, devastated, and large numbers of countries are basically fiscally insolvent. And so there's going to need to be a major focus on investment, kind of like the Marshall Plan for the planet, if you like. And we need to ensure that whatever efforts are made, you know, in that direction, incorporate what we know now in terms of these risks. And we're talking about building back better and a green development. It is really important that we shape development in ways that aren't going to amplify future problems. And a good example, to speak about something offside, if you like, is infrastructure. Tom, you know, the volume of infrastructure that will be built between now and 2050 is so large that 75% of the global built infrastructure stock that will exist in 2050 hasn't yet been constructed. We're talking about new roads being built that will circle the planet some 600 times. That's over and above what we have today. And since 95% of deforestation, say in the Amazon, happens within 5 kilometers of a road, Where you place those roads will have a major impact on your trajectory of deforestation. So what, we sort of have a pathway now, and as we're looking at this so-called Marshall Plan, do we build a world where we de-risk? As small as these risks might be, it's a black swan event. If they happen, the impacts are cataclysmic. So do we build such a world, or do we continue business as usual? And for that, this debate is really important, and your participation in it and reaching out to the broader community is so vital. Taking this beyond the science and putting it firmly into the policy domain.
Your remark, Nick, reminds me of something a British environmentalist, Adam Swaden, coined. It's actually not a black swan, it's a black elephant. A black elephant is a cross between the elephant in the room that we can all see, it's right there, and a black swan that is maybe a low probability but massive impact event. This is a high probability, massive impact event that's sitting in the middle of the room. And getting the world to take this on, I think is going to be a huge challenge. And your point about infrastructure, Nick, is so important, because coming behind President Biden's, and we'll get you in a sec, Dr. Lim, behind President Biden's bailout for COVID-19, the 1.9 trillion we're talking about to revive our economy. It's actually a huge infrastructure bill. And that's in America. Everyone around the world is now thinking of investing in infrastructure, which means more road, more rail, more airports, more connectivity. You've given me my assignment. I need to write a column about how we connect the pandemic to those future plans. Dr. Lim.
Yes. You asked about breaking silos, and I did mention that the recovery framework of ASEAN already mentioned something about requiring mainstreaming biodiversity into the plans and programs for recovery. And mainstreaming biodiversity is important when you speak and when you talk to the other sectors, with agriculture, for example, and infrastructure. We've organized, for example, a conference together with the landscape architects here in Southeast Asia. So there's a big recognition among leaders and among decision makers that because of what's happening to us now, which everybody feels the impact. They're starting to see that integrating biodiversity into the planning processes is becoming an important measure to eventually address future pandemics and other crises. And I think that's important, and it's really the challenge. Of course, another challenge is really to also translate that into more action on the ground, and that's something that that the ASEAN is ripe for it. The partnership, the political will is there, and it's important that everyone works together so that we can achieve the direction of addressing future pandemic with biodiversity and, of course, wildlife protection in mind.
Well, it's why this conversation is so important. John, I'll get you in 1 second. In that we've had a natural systems event. It's had vast economic consequences. We're talking now about remediating those economic consequences, but the time devoted to actually focusing on the source of the natural system event that caused those consequences, I fear is really being minimized, and it just makes this conversation so much more important. John, please.
Thanks very much. Yeah, and the world's a complicated place. So to make sense of it, we break it into bite-sized pieces. And if we just look at the conversation we're having today, you can talk about biodiversity and climate change and public health and wildlife, and we separate it just so that we can, understand it, know how to intervene. But what we're finding is if we keep going down those channels and investing down those silos, we're actually not having the impact that we need to have. We need to look at where there's the crossover, and for $1 investment, look for multiple returns. Now, let's just think for a moment about our last wild places. The be they in protected areas, traditional protected areas, or community protected areas. If we invest in them, we're going to protect wildlife, preserve biodiversity, combat climate change, address the potential of new pandemics emerging from wildlife. We're going to generate local community benefits. So we're going to be delivering on sustainable development goals. We're going to have to help produce fresh water. By investing in our last wild places and the people that live within and around them, we're going to have multiple benefits, and we have to start viewing it that way. And investment in conservation can't just come from the conservation sector. It needs to come from the health sector, those that are investing in climate, those that are investing in all other sectors, in security, in development. So if we start looking at the multiple benefits that can be derived from a single intervention and start viewing it that way, then we can change the way we think, and we can change the way in which some of these silos have developed over time.
I love that. You know, really, that's something our Secretary of Defense should be talking about. Our Secretary of State, speaking as a parochial American just for a second, you know, our Secretary of HHS, our Secretary of Commerce. If there's one thing we should be doing across the government, it's investing in the protection of our last wild spaces. Steve, did you have a thought on this?
No, I think that was very well said by John. And you know, these are global goods, what's left of wild nature, and we can't expect, for example, tourism to cover the cost of securing those areas. We all need to invest, no matter where on the planet these areas are left, our coral reefs, our tropical forests, and so on. I guess one of the reasons we wanted to have this session today is, you know, this growing sense of urgency. And I'd kind of like to ask all of you, I mean, one of my personal worries, I'm thrilled that we're seeing vaccines being rolled out in different parts of the world, but I do worry that we're going to forget, that we're going to become complacent, and that, you know, the very interesting propositions you've made, John, for things like CITES are going to take time. Given the urgency and the need to maintain momentum, are there things we can be doing, that the G7, the G20, others can be doing now? Obviously, within our own governments, we have to have a One Health approach. And there are active discussions, for example, within the US government about breaking down these silos between Department of Interior and USDI and the State Department and Commerce, et cetera. But does anyone have any thoughts about how we don't lose momentum as vaccines roll out? Because human nature doesn't tend to deal with crises after they're starting to fade.
Yeah, Steve, I did mention that in also my talk earlier, that the rollout of vaccines must not be the end, you know, must not be viewed as the solution to it's already giving us confidence that the end of the crisis is almost in sight, and but we don't want to lose the momentum. We should never lose the learnings and learnings of this pandemic, and so the conversation needs to keep going. This webinar, for example, has provided more opportunities to reach out to more people. And it's the same thing that we're doing in the ASEAN. You know, even with the pandemic, we tried to organize webinars and workshops online so that we can reach out to more people. And it's not just within the environment sector. As I mentioned, we've organized a One Health webinar, and you know, and also with the infrastructure and development sector. So it's, you know, I think this is also the right time to be able to organize this online and then make the biggest impact if we you know, work with all like-minded at this time, but then eventually reach out to those who are not converted. So
let me ask, sorry, thank you, Doctor. I didn't mean to interrupt. Thank you. Did you want to say something more? I'm sorry. Were you done?
Yes, thank you, Tom.
Sorry, didn't mean to dive in there. You know, one of the things I learned covering the Middle East all these years is that the way you often get big change is when you get the big players to do the right thing for the wrong reasons. That is, if you wait for everyone to do the right thing for the right reasons, you tend to wait forever. But, you know, if you get people to do the right thing for the wrong reasons, by wrong, it may mean because they're going to make peace because they're going to get an arms deal out of America or whatever. But the right reasons end up having vast amplified spillovers. is there a way to make, I'm going to challenge you, to make a cynical argument for this, a profit motive argument? How do you leverage, because if, I've always said, environmentalism, climate change, these are scale problems. And if you don't have a scale solution, you have a hobby. And I like hobbies. I used to build model airplanes, but I wouldn't try to save the planet as a hobby. And because of that, there's only one thing as big as Mother Nature, in my view, or nearly as big as Mother Nature, and that's Father Greed, the market. How can we actually leverage, reshape the market, incentivize the market to be our friend for this One Health approach and not our enemy? Nick.
Turning back to infrastructure, we've been talking to some of the world's largest private equity holders in infrastructure, and they're ready to do the right thing, okay? Forego the bad projects, invest in the right ones, but they need a level playing field. They worry if they opt out of pursuing a particular project, someone else will come in and fill that space. And so we need standards. And I use that as an analogy for the type of efforts we need more broadly, as well as in dealing with wildlife. Just to add, I think there's a lot of opportunity to engage with companies. We're working with a large number of US and Chinese and other companies, IT companies, to take illegal wildlife trading off the internet. I mean, that's fascinating. And the companies are doing the bulk of the work, and they're, and they're monitoring trades, and they're taking action. I mean, Amazon actively engaged in this. And so that's great. Recently, we've had some experience successfully reducing some of the, underground illegal trade, for instance, with elephant ivory. It's one thing to actually impose a ban, but you're always going to have a number of people who are going to buy. And so, you need to deal with that portion of the population. And while 93% of the population in our survey in East and Southeast Asia indicated that they would not buy wildlife, for consumption, 7% said they would. So how do you deal with that? And we had some great experience sort of, reaching out to consumers when we knew they were, approaching a market using geolocation software. And so that they got a text message warning them about the risks in that case, in terms of buying ivory. Those sorts of innovative solutions need to be co-created with companies. And I'm actually quite hopeful that we can find a way forward. We need our thinking caps on.
While you were speaking, John, I'm going to get to you in 1 second. While you were speaking, Nick, I just Googled how to buy a pangolin. And the first thing that comes up is Facebook users are buying and selling pangolin parts, even though it's illegal. And so I think that's a really important area to be focusing on. John.
Thanks, Tom. And just firstly, going back to Steve's point, then I'm going to come to yours on markets. Human memories are short. And I think that's something that Nick touched upon earlier. But also, if you look at the SARS pandemic, there were a lot of measures that were taken after that. And 10 years later, they'd been relaxed just because it seemed a long way away. It hadn't happened again. So memories lapse. That's why we need to use this moment to institutionalize change. Because human memories are frail. We get overconfident. We forget what happened. So if we can institutionalize change, make changes to the legal framework, you'll be sure in 10, 20, 30 years, we haven't forgotten because the system doesn't allow us to forget. So what do we do there? That's why we have to move now to initiate negotiations while this is fresh in everyone's memories. Let's move now to initiate the negotiations and the changes to CITES. You could make them very quickly. The mechanism could move fast. Let's now get a negotiating mandate from the UN General Assembly to have a new protocol on wildlife crime under the UN Convention Against Transnational Organised Crime. So I'd say now is the time to move. We have the attention of prime ministers and presidents. Everybody is focused on this. Now's the time to make these fundamental shifts and to embed them in the system, because we know if you don't embed them in the system, we will have forgotten about it in 10, 20 years, and we're going to be in exactly the same position then as we are now. In terms of markets, Tom, you're spot on there. And I think, we have to look at the financial sector and ensure the financial sector is not investing in the destruction of nature, rather that investment is flowing in a way that is not going to destroy nature, hopefully be at the least neutral, but one would hope having a positive influence on nature, and also look at the role of the corporate sector. So the whole issue of due diligence, disclosure needs to be stepped up. We've spent too long relying upon voluntary mechanisms. Voluntary mechanisms are fine, they have not delivered. It's time for governments to step up again, take on their regulatory role, and start putting in place obligations on financiers and corporate sector related to due diligence in terms of where they're sourcing their raw materials from, and in forms of disclosure in terms of where they're investing and the impact of that. So this is a time where this is a broader issue than just illicit wildlife trafficking or wildlife crime, but where we do need governments to step back up, recognize that voluntary measures alone are insufficient, and start putting in place more regulatory measures to ensure that where finance is flowing and where the corporate sector is active, that this is not contributing to the wanton destruction of nature or to illegal activity.
You know, Steve, I'm going to get you in 1 second. I just want to pick up on something John said, because it really suggests a column idea for me. And since I live by writing columns, it's really important. It's you know, every new administration, John, every new president, they want to leave their mark, want to leave a unique mark. And when President Biden came in, he actually extended the New START treaty with President Putin of Russia, and that's good. We certainly want to see that extended. But what you've really given me an idea of is to write a column that says to President Biden, your chance to leave a mark is really on taking the CITES Treaty forward into this new age and making it apply in a preventive way to global pandemics. I mean, you were elected in part because of a pandemic. Your term will be shaped by the fallout of this pandemic. And if you want to leave your unique mark, the way President Reagan did through Montreal, or President Obama did through contributing to Paris, and none of them did it alone, but they all contributed. This is the Biden treaty.
Can I add to that, Tom, that it's actually called the Washington Convention in many countries because it was adopted and signed in Washington, D.C., and the United States was the first party to the convention, and there's now 183 parties. So wow, the US has form on this one.
Fascinating. This is so good. Steve, I'd have paid to be here. This is just so interesting. Go ahead. And then I know, Dr. Lim, you had a point too. We'll get to you before we close. Steve, go ahead.
I just want to make sure we address your very important question about selfish reasons for example, the corporate sector to engage in this. I think captains of industry have children too. And I think anyone who's following global trends, looking at how we're exceeding planetary boundaries, recognizes that we're on an unsustainable path. And the good news is feeding future generations, preventing pandemics, mitigating climate change, all has a common denominator. It's about protecting what's left of wild nature. And so if you're a company, if your time horizon is intergenerational, you will do the right thing. And that's obviously our challenge. If profits are assessed on a quarterly basis, that creates some of the wrong incentives. And so I think most of my colleagues who are in the corporate sector, they recognize that we're mining nature's capital instead of living off of the interest that it provides for us.
Is there a problem with James?
And so I think I'm seeing more and more opportunities for partnerships so that we're not just talking to fellow conservationists, so that as Nick was saying, WWF is working with industry all over the world. We're working with government agencies, but honestly, it's in everyone's best interest, especially if we think about intergenerational equity. If we think about our kids and their kids, these are no-brainers. We can't keep going down this path. Every major barometer of what's happening on planet Earth is telling us that. And so I want to be optimistic that we are going to make the right decisions in the near term.
You know, Steve, I'm actually working on a column for tomorrow that begins by saying that there's a question I've heard, we speak very parochially now as an American, this question I've heard more in the last 6 months than I've heard in the previous 66 years of my life. And the question is, can you believe this is happening in America? Can you believe I spent all day hunting online for a drugstore to get a COVID-19 vaccination? Can you believe this is happening in America? Can you believe that Americans actually ransacked their own capital? Can you believe this is happening in America? Can you believe that people in Texas today, as we speak, are boiling snow to flush their toilets because their grid was completely collapsed by a climate, likely climate event. We don't know for sure. The dipping of the Gulf Stream with an Arctic blast. Can you believe this is happening in America? But there's also another thing that happened while all this was happening. The same America actually landed a spacecraft on Mars, 292 million miles away, and we hit it like a dart in the exact spot we wanted to land that spacecraft. And what you see in America today is a struggle, I would say, between Texas thinking and Mars thinking. Texas thinking was all about looking for the cheapest, low-cost solution and not thinking about any of the externalities in how we generate electricity. Mars thinking was, wow, audacious, bold, long-term, built on science. How do we actually land a research craft on a planet 292 million miles away? And this struggle in America today, I would argue, between Texas thinking and Mars thinking, a Texas mindset and a Mars mindset, that's really the challenge that we have to overcome right now. It's not a question, it's just my rant, but it's
no, you're absolutely right. It's that tension between short-term profits and long-term investment. And I think everyone that we've heard from today has talked about investing in the future. And that's the amazing thing is the solution is in front of us. And it does relate to our relationships with wild nature, as everybody has said. And we definitely need, our government departments, our ministers, all thinking about this, because we've had these conversations within the wildlife health and conservation communities for decades, but we don't necessarily pull the levers of power. And so to have an opportunity to get this dialogue out to a broader audience, I think is really, really important. And it's not a moment too soon, as I think we've heard over and over again.
I want to make sure we get your point in before we close here.
Yeah. No, I was just saying that I was just thinking in Southeast Asia, we have this is the engagement with the private sector. The arguments that we make, like there are already learnings within Southeast Asia, like Singapore, for example, has engaged the finance companies, financial institutions to consider environmental, social, and governance criteria. And now some of their corporations are starting to think about, they are integrating sustainability goals within their plans, within their business models. And this is something that some ASEAN countries are leading on. But in the midst of the pandemic, something also was triggered because a lot of these companies in the ASEAN experienced the impacts at the economic level. And I think through that experience, it is this time that it becomes easier to explain to them the interconnection between nature and their lives, because what the pandemic has demonstrated is that they cannot move within their own silos, within their own business deals. So because of this experience that they have, I think we should build on that, because now they know how it feels to be impacted by something that's related to not protecting the environment, to not protecting nature. So yeah, that's how.
Thank you. There's a question that just keeps coming up in the chat here, and anyone, Dr. Lim or anybody else, please address it. And it's, what can I do? I'm just one person here, but I deeply care about all of this. What can I, as an individual, do? Anybody?
Well,
Okay.
Somebody jump in that. You don't want to leave that one hanging.
So, yeah. So first, you don't belittle your capacity as an individual, because individuals acting together makes a bigger impact. So that's I think the first thing that you have to keep in mind. That and then the awareness, read, uh, you know, uh, just caring, internalizing what is happening now, and how it relates to how you treat the environment. I think that's the first thing. You have to not just think, but you need to have the passion as well to do something about it. That because you know that it impacts your life. So the change should be within yourself as well, because you know that it impacts your daily lives, and through that you will be able to know, it. You don't have to be an environmentalist to do something about it. You can be. We talk about mainstreaming. If you're an architect, for example, or engineer, then you think about how you will be able to design something that will not, that will not that will leave the a small footprint on nature, so that eventually, if more architects and more of your circle will be able to be convinced that this is the right way to go, then you make a bigger impact. If you're in the business sector, for example, you incorporate nature, biodiversity into your business model, and if you start to think that way, and you start to know that it's good for you and it's good for your business, then it will come out naturally. And so as an individual, don't think that you're just an individual, you can't do anything about it. You need to to be an influencer. Once you're able to do that, then you can make really a better, a bigger impact.
Anybody else? John, please.
Thanks very much, Tom, and good question. And if I can take it from a perspective of just an individual, what can you do as an individual? As an individual, you're a consumer. So think about what you're buying and what you are consuming. That includes what you're eating, what you're wearing, what you're drinking. Then as an individual, you are an investor. Where are you investing? What corporate entities are you investing in? Where are you putting your money? Is it into entities that are taking environmental considerations into account in what they're doing? If you're going through a financial investment entity, is that looking out for where it's actually putting your money? So look at what's your role as an investor. And then as a citizen, you've got the issue of who you are going to support politically, obviously, but also if you are convinced by what we've said today about the need to reform the international system, as a citizen, make your voice known to those who are going to take the political decisions. So be active. Write to in the United States, your congressman or woman. And I'm sure Nick would say, get involved with an organization like his in an individual capacity. But I'd say look at it as a consumer, as an investor, and as a citizen, and there's a hell of a lot you can do.
That's very good. I really like that. Steve, Nick, anything you all would add to that?
I think that was excellent. And I think we're really talking about bringing a One Health approach to bear on our daily lives and the decisions that we make. It really adds up. And I think people are more powerful than they realize.
I'd agree with that. And I think just picking up from the themes that John raised, I think we have a tendency as a species, as individuals, to blame other people. So, oh, that's not me, it's someone else. Even as I have just purchased a wild macaw, which perhaps trafficked from the Orinoco Delta might give me bird flu. I say that tongue in cheek. I haven't purchased a wild macaw, but you understand what I mean. And I think it's about us understanding the impacts of the decisions we make. That said, people are not irrational. And people make choices, and often for good reasons. And I think when going back to Ebola in West Africa, there is a dependency on bushmeat from very poor communities. They typically hunt during the lean season between the rains, and they recognize there are risks, but they still do it because there are few alternatives. And of course, when I'm faced with nutritional insecurity, access to protein, and so on and so forth, they make a very rational decision to do it, because their cost-benefit calculus is very different to ours. And I think if we're going to be successful in changing behavior, we need to understand the huge diversity of cultures, needs, situations across our planet, and we need tailored solutions that address them. There is no one-size-fits-all approach. And I think that's where we need to begin. But I do believe that there's lots of opportunity. There are a lot of positive things happening. And Tom, just to close out on a point that you raised in terms of trafficking of pangolins and Facebook has joined the movement to try and take that trade off its platform. And I think that's just great.
Yeah, it's a challenge because with both YouTube and Facebook, they will tell you that they're working hard, and they are working hard to take these things off their platforms. The problem is when your platform is 3 billion people and you fix 99.8% of the problem, 0.2% of the people on a 3 billion person platform can buy and sell a lot of pangolins. And it's really one of the problems of the law of large numbers now with these systems that they haven't managed to overcome. So I wonder, Steve, if there's any other issue that you would like to raise right now that we haven't addressed. Just to pick up, there's one I want to pick up on, Nick, from yours that I've learned in this session, and that is, this whole issue of food insecurity that compels people to hunt, endangered species and bushmeat, whatnot. What's the fix for that? Is it just simply food aid? That doesn't feel right. That's not actually going to be a sustainable fix. What's the fix for that?
That's a very good question. First of all, let me preface the answer by saying it's not true that many consumers of wildlife and wildlife products do so only because there are no other alternatives. There are many people who purchase wildlife and it's a luxury product or a boutique product. And I think that therein lies an opportunity to change behavior and to significantly reduce these impacts. But I think one of the challenges we have as a species is that the impacts of change and the fact that we need to adjust ourselves to deal with them sometimes take a long time to manifest themselves. So let's say deforestation has increased the risk of a spillover of a zoonotic disease, let's say Ebola, in the Upper Guinea forests in West Africa. That's taken place over a period of time. Those risks are now manifest today, but human behavior hasn't changed to reflect the new risk paradigm that we confront. And that is the situation we find ourselves in. And that is why you need global policy and you need global mechanisms in terms of trying to address these issues. The solutions have to be locally driven. It's not for us to sit here and concoct the right food solution for West Africa. It's the communities there who need to establish that. And that is a bottom-up approach, working with the communities, understanding those risks and building out from there. And there is no alternative to that hard slog. And we as a global community in our Marshall Plan for recovery needs to factor that into the equation.
And what Nick was just describing is really encapsulated in our own approach to foreign assistance, where we still are working towards a One Health approach as the US government in terms of coordinating food assistance, emergency assistance, pandemic preparedness. Those offices, for example, in our own State Department and USAID are separate divisions of those agencies. And there's active work now to bring those threads together because of the relationships that we've been talking about. So I'll stop there.
I'm going to ask everybody to just hold off for a second. This has been a terrific discussion. I'm actually glad we got to go a little longer and deeper. Jane Goodall is now connected. We're just establishing the line. Well, I'm sure you all know world-renowned scientist and advocate, Dr. Jane Goodall, the founder of the Jane Goodall Institute. She is an iconic voice for holistic, compassionate, and sustainable solutions. And she continues to influence attitudes and policies on issues ranging from human rights to the climate crisis. to inspire action through the power of hope. Dr. Goodall, we're truly honored to have you with us today. It's a particular treat for me to be with you again, and over to you.
Thank you for inviting me. You know, I'm sort of coming into this from a slightly different perspective. So I'm going to start just to bring you into my world with the greeting I so often start a talk with from the chimpanzees. That simply means this is me, this is Jane. Anyway, let me try and put some thoughts together that are perhaps a little different. And certainly there's one thing about this pandemic, it has woken people up. There is a silver lining. I know how much suffering it's caused, how much economic chaos, how many jobs lost. But at the same time, because of it, because it's actually affecting people, it's affecting governments, it's affecting businesses. And so they're waking up to the fact that we brought it on ourselves. We're paying the price for not listening to those scientists studying zoonotic diseases who've been predicting a pandemic like this for a very long time. And of course, it's all, as you all know only too well, because we have absolutely disrespected the natural world and we have disrespected animals. And because I'm talking to a group of people who know far more about zoonotic diseases than I do, it feels a little strange. But as we all know, it's the destruction of environments, pushing animal species closer together, pushing them closer to human habitation, that's led to one way that zoonotic diseases can arise, this closer contact. And then, of course, there's the wildlife trafficking, which the Jane Goodall Institute has been involved in for a very long time. And I think anybody who cares about conservation and loss of biodiversity and climate change, for that matter, is concerned about the way we are disrespecting the natural world. We're part of that natural world. We're not separate from it, and we depend upon it. And this pandemic is helping people realize how close this interrelation between us and the natural world actually is. And as everybody know, well, not everybody, but all of you know, if we carry on with business as usual, if we carry on thinking about short-term gain rather than long-term investment, then that's going to be the end. I mean, we don't have unlimited time. I know there are scientists who say it's too late, but I firmly believe, and luckily others do too, that we have a window of time. But it's not a big window and it's closing. And we need to get together and change our relationship with the natural world and our relationship with animals. And this, idea that we can have unlimited economic development on a planet with finite resources simply doesn't make sense. And it's because we have been so callously and greedily destroying the natural world that these situations are arising, leading to this particular pandemic. But there'll be more pandemics if we don't change, if we're still around to have these pandemics visit us. And, I've been out in Africa and I visited Latin America many times and parts of Asia many times. And I've seen the change as human populations grow and as they move further and further into the environment, and they're building roads and making dams and mining and extending their settlements and growing crops, felling trees to grow the crops and graze the cattle. And as somebody said, if you're living in extreme poverty, what else can you do? You're going to cut the last tree to try and make money from charcoal or grow more food to feed your family. You're going to fish the last fish to feed your family. If you're in an urban area, you're going to buy the cheapest junk food. You can't make that ethical choice that somebody was just talking about. You have to buy the cheapest because that's the only way to survive. So alleviating poverty is kind of underpinning all of this. And then from the hours that I spent in the rainforest at Gombe, that's where I learned how everything is interconnected in nature. And every species, no matter how insignificant it seems, has a role to play in this amazing and beautiful tapestry of life. And as we lose biodiversity, as we drive species to extinction in more and more places, we're tearing holes in this web of life. And that will ultimately lead to total ecosystem collapse. Climate change isn't helping. So we clearly have to think through different ways of doing things. I think the fact that the illegal wildlife trade is so often linked by these powerful syndicates to trade in drugs and arms and human trafficking as well, that's another silver lining, because it's brought in Interpol, it's brought in governments and businesses, it's brought in the United Nations, what's it called? It's something about crime and drugs anyway. And so this greater interest in stopping the wildlife trafficking than there ever has been. I think we need to grab onto this opportunity in time. And as someone else has said, I know in this conference, it's not just the wildlife markets of Asia, Africa, and so on. It's our factory farms. I've been to a wildlife market. I think it was in Hong Kong ages ago. I've been and seen once is enough in a factory farm. And it's not just the cruelty, it's the fact that so often they're so unhygienic with blood and urine and feces all over the place. No wonder bacteria and viruses can spill over from an animal to a person. We make it easy for them. And I'm told by my scientist friends that from a stressed animal, it's easier for a virus to spill out. Don't ask me if that's true or not, but that's what I'm told. So there's something else we've got to do, as well as alleviating poverty and helping people understand. And that's better education. I mean, honestly, I met people in China, and I've been going there since the mid-90s, who honestly believe that ivory comes from elephants that have died a natural death, that other people believe that the ivory is shed every year. People say, oh, but that can't be true. But if you haven't been educated, if you've never seen an elephant, if you happen to know that stags can shed their antlers every year, these huge antlers, why wouldn't you think that an elephant could shed its tusks? You don't know anything about anatomy or dentistry or anything like that. So education, and the Jane Goodall Institute for many years now has been involved in all of these different interrelating aspects of this sad picture, this devastation that we're bringing upon ourselves. And it was when I realized, when I was traveling around Africa, learning about why chimps were disappearing, what was happening to the forests, that I realized that it wasn't just chimpanzees facing these problems, it was humans living in poverty. And that's when we began our Take Care or Takari program. And that from the very beginning was a holistic program, including alleviating the poverty, finding alternative lifestyles, improving the education of women, giving them microcredit opportunities, water, sanitation, as well as caring for the environment. And because we work with the people, because we ask them, what can we do to make your lives better? We didn't tell them what we were going to do. And so gradually they've come to be our partners in conservation. We've given them the tools. They've learned to use smartphones to record the health of the forest as volunteers. They're proud of it. And they understand that protecting the environment is for their future, not just for the future of wild animals. And they're beginning to understand more about these wild animals and learn more about why it's important to save the biodiversity of the area where they live. And that program, by the way, is in 6 different African countries. Another silver lining, we're beginning to, more and more people are beginning to understand the terrible environmental devastation of animal factory farming and industrial farming, the loss of biodiversity, and again, the situation in the factory farms, which enable zoonotic diseases quite easily to spill over into us, or rather the viruses and bacteria spilling over into us. In our youth program, Roots and Shoots, which is addressing the education, it's now in 86 different countries around the world. It's for young people from preschool and then university, everything in between, and a lot of people now who are actually adults, even in old people's establishments. But basically it's for youth. And again, it involves the young people choosing projects. They choose, we don't tell them, but they must choose a project to help people, a project to help animals, a project to help the environment, learning that everything is interrelated. That message that was just given so clearly about the impact you can make as an individual by asking, when you buy something, first of all, do I need it? Where does it come from? In its production, did it harm the environment? Was it cruel to animals? And is it cheap because of child slave labor somewhere else, or sweatshops or something like that? And the cumulative effect of millions, then billions of people making ethical choices in what they buy once people are lifted out of poverty, then that's going to make the world a much better place. And yes, consumer pressure on business and on governments too. All of it interrelated. Everything in this planet is interrelated. And we ignore that to our peril. And then the last thing I want to say is in these gatherings, people talk about the threat to species, talk about the number of animals in a species that are killed and whether that species should be on some kind of endangered species list. But every single one of these animals, whether they're out in nature, whether they're in wildlife markets, whether they're in factory farms, they're individual. They have personalities, all of them. They are capable and do feel fear and terror, and they certainly feel pain. This is suffering on an unimaginable scale, an unimaginable scale. They're killed, sacrificed on the altar of human greed and corruption. So I thought it was important to end this important meeting with a message from the animals, for their sake, as well as for the sake of the planet, as well as for the sake of our own children. We need to change for the sake of the animals. Thank you.
Dr. Goodall, thank you so much for that message. It's just a wonderful way for us to tie up what's been an amazing morning. I really mean it. I would have paid to have had the opportunity as a journalist just to be a fly on your wall and also to ask some questions. My big takeaways from this, first and foremost, is that job number one for all of us as individuals, as countries, is to invest in protecting our last wild places. I always try to look for what is the one leverage point that if you press on it, you get the most benefit across the most fronts for the least price. And it seems to me investing in the preservation of our last wild places is really that. My second big takeaway is that all of us are smarter and more powerful than one of us. We need to break down these silos. We all need to be in it together. But most of all, we've got to be partnering with the indigenous people who live every day in and around these areas. And if we cannot be enlisting their buy-in, if we can't make this good and working for them, it doesn't matter what global treaty we have. My third takeaway is that something the great environmentalist Dana Meadows used to say when asked if it was too late to fix climate change. And the answer was, we have exactly enough time starting now. We have exactly enough time starting now. And it starts, I think, we've all had an incredible lesson in this last year on natural systems. This pandemic was a natural systems event. And if you didn't look at it through the prism of natural systems, if you looked at it instead through the prism of markets, for instance, if you thought if the stock market was going up, we were winning against the pandemic, you really got off track. This was a natural systems event. And when this pandemic was one of the challenges that Mother Nature throws at her species to sort out, who will get their DNA in the next generation, even though viruses are actually just other living species. In terms of humans, it was a natural challenge. And when we face these natural challenges, Mother Nature really asks three questions of us. Well, the first thing she says is when you're up against a natural challenge, who do I reward, says Mother Nature. I don't reward the smartest. I don't reward the strongest. I actually reward the most adaptive. Who can adapt the best to my flood, drought, hurricane, you name it. In this case, for humans, a pathogen called COVID-19 or SARS-CoV-2. And she really asks three questions about your adaptation strategy. The first is, are you humble? Are you humble? Do you respect where this virus came from and how it needs to be addressed? Second, she asks, are you coordinated? Are you coordinated? Because I evolved pathogens like this in terms of human beings over millennia to find any crack in your individual or collective immune system. Are you coordinated? Are you working together? Third, she asks, Mother Nature, I'm just chemistry, biology, and physics. That's all I am. You can't, talk me up. You can't talk me down. As my teacher, Rob Watson, likes to say, you can't say, Mother Nature, we've been having a recession. Could you take a little time off? No. She's going to do whatever chemistry, biology, and physics dictate. And she always bats last. And she always bats 1,000. Do not mess with Mother Nature. So if we are humble, if we respect her, if we are coordinated, and if we build our responses on chemistry, biology, and physics, not politics, ideology, and election calendars, we can be in harmony with her. But we have exactly enough time starting now. So to the organizers from Cornell and World Wildlife, thank you so much for hosting this, organizing this. This was a huge effort. And I feel honored to have been a part of it. I want to close now by turning over to Professor David Lodge, who's the Francis DeSalvo Director of the Cornell Atkinson Center for Sustainability and a professor in the Department of Ecology and Evolutionary Biology at Cornell. David, I'm going to hand it over to you to close. Thank you very much.
Thank you, Tom, and thank you all for participating in this critical conversation on the basic causes of pandemics and how we might reduce future pandemic risk. The challenge is great and complex, as many, if not all, previous speakers today noted. The urgency, though, is greater, as Doreen Robinson noted, and it is matched, at least for me, by optimism. I know that moving from expert knowledge to practical impact is often extremely difficult. We're in a pandemic currently. That's a symptom of that. But solutions are possible. And I've seen solutions in such complex situations in many other realms of environmental and health practices and policies. Consider the example provided earlier today by David Nabarro's comments about the effective bird flu response that included strong collaboration among national leaders, the UN, and animal and human health experts. To reduce the risk of future pandemics, we need a One Health effort that is permanent, institutionalized, coordinated, global, and systemic. An effort that is commensurate with the dramatically increased flatness of the world that Tom Friedman reminded us of today. At Cornell Atkinson, we look forward to continuing to do just that, connecting cutting-edge research to large-scale challenges and breaking down silos, especially in partnership with organizations like World Wildlife Fund. Together, we will continue to advance a knowledge to impact approach to One Health. Thank you, participants, and thank you, audience. This webinar has been recorded and will be made available online soon. This concludes our event. Thank you.